Hey everybody, it says we're live. So tonight, if any of you are pharmacy techs out there, a kind soul lent me this book and lent me hundreds, maybe thousands, I can't even get them all out, of note cards. And I'm going to read each one. Okay? So, if you got to take this test, this is a video you can just listen to or watch, study at whatever level you want. Once we get through all the note cards, we're going to flip to the back and we're going to take the practice test. Right there. That has the answers behind it. This is, we'll go through all these. Okay? The idea behind this video is it gives me something to listen to. So once I record it, I can listen to it over and over and teach myself. But I figured if I'm going to learn that for me, I might as well share it with you as well. So that's the idea. We're going to be here a while, so let's get started. I got set up here to put each note card down, and we'll read each one by one. There we go. All right, let's get going. I don't know what the color coding's about, but I guess we'll figure it out as we go. So let's start with the blue. These are dark blue. These are dark blue. These are light blue, so we'll start with light blue here. All right. You see that okay? Yeah. The indication for mupirocin bactroban is bacterial infection. The indication for ranitidine Zantac is duodenal ulcer. You're going to hear me say lots of words, very funny tonight. Sublingual nitroglycerin is used for acute angina pectoris. The indication for acyclovir Zivirax is herpes simplex or herpes zoster. The indication for misoprostol, Cytotec, is gastric ulcer. The indication for tamsulosin, Flomax, is enlarged prostate. The indication for modafinil Provigil is narcolepsy, excessive sleepiness. The indication for baclofen Kimstro is muscle spasm. The indication for famotidine Pepcid is ulcer. The indication for clopidogrel Plavix is stroke prevention. The indications for lansoprazole Prevacid are ulcers and gastroesophageal reflux disease, GERD. The indication for albuterol, acuneb, is asthma. The indication for ramaltion, rosarim, is insomnia. The indication for pramipexole, Mirapex, is Parkinson's disease. The indication for cimetidine, Tagamet, is ulcer. The indication for Monteliacast, singular, is asthma. The indication for divalproex sodium, Depakote, is epilepsy. The indication for clomiphene, Clomid, is infertility. The indication for procainamide, Pronestil, is arrhythmia. The indication for dutasteride, Avodart, is enlarged prostate. The indication for clonidine, Catapress, is hypertension. The indication for tadalafil, Cialis, is erectile dysfunction. The indication for tacrine, Cognex, is Alzheimer's disease. The indication for alendronate, Fosamax, is osteoporosis. The indication for prazosin, Minipress, is hypertension. The indication for lisinopril, Prenavil, or Zestril is hypertension. The indication for esomeprazole magnesium, Nexium, is gastroesophageal reflux disease, GERD. The indication for amoxicillin, Amoxil, is bacterial infection. The indication for atazanavir, Ray-Ataz, is HIV infection. The indication for calcium polycarbophil fibercon is constipation. The indication for pseudoephedrine, Sudafed, is nasal congestion. The indication for buspirone, Buspar, is for the control of anxiety. The indication for oseltamivir, Tamiflu, is influenza. The indication for levothyroxine, Synthroid, is hypothyroidism. The indication for metaxalone, Scalaxin, is muscle spasm. The indication for nedochromal, Tylade, is asthma. The indication for Lorabid, are bacterial infections. The indication for esmolol, Brevibloc, is dysrhythmia. The indication for fluoxetine, Prozac, is depression. The indications for epinephrine are asthma, cardiac arrest, anaphylactic shock. The indications for omeprazole, Prilosec, are ulcers and gastroesophageal reflux, GERD. The indication for nifedipine, Procardia, is hypertension. The indications for celecoxib, Celebrex, are osteoarthritis and rheumatoid arthritis. The indication for atorvastatin, Lipitor, is hyperlipidemia. The primary indication for rifampin, Rifidin, is tuberculosis. The indication for mirtazapine, Remeron, is depression. The indication for irbesartan, Avapro, is hypertension. The indication for metformin, glucophage, is type 2 diabetes mellitus. The indication for zolpidem, Ambien CR, is insomnia. The indication for ramipril, Altase, is hypertension. The indication for salmeterol, Ceravent, is asthma. The indication for penicillamine, cupramine, is rheumatoid arthritis. The indication for losartan, Cozar, is hypertension. The indication for amlodipine, Norvasc is hypertension. The indication for zyprasidone, geodon, is psychosis. The indication for duloxetine, Cymbalta, is depression. The indication for methyl-dopa, Aldomet, is hypertension. The indication for rabaprazole, Acifex, are gastroesophageal reflux disease, GERD, and ulcer. The indication for almotriptan, Axert, is migraine headache. And finally in this set, the indication for disopyramide, napamide, is arrhythmia. So that's one set. One set. Woo! There's a lot to go. Oh, I guess I can put me up like that. Oh, there's two of me. I need a drink if I'm going to read all these. Wow. Dedication. Here we go. This is one of those tests where there's so much information and it's so random that I'm going to rely on prayer a lot. And I'm an English teacher in my day job. And I'll tell you a story about I was a chemistry major in college for a while. And this is giving me dark flashbacks. But farm tech is a great part-time job. For working class job, it's pretty great all around. The pay's pretty good, and if we can pass this test, we'll get our money back, which is about $150 to take this test, and we'll get $2-3 an hour raise, something like that. I think that's what I'm telling myself at least. So I don't know what these are. Oh, okay. These are like medical language. I'll go through these and then I'm going to go get a drink. This looks like B with an upside down. Oh, hang on. AQ. Okay. AQ. Hang on. Let me turn this back on. There we go. AQ. Pharmacy abbreviations. That's this section. Is water. The first section was indications. That's what the blue words were. Stat. We know this from ER. Stat means immediately. PRN. As needed. I am intramuscular. Cap. Gen Z, this means you're lying. That's not what it means in the pharmacy. Cap. No cap. It means capsule. No cap. It means capsule. I like to lean in this when I'm school teaching to make the kids cringe. But I'll try to hold the commentary so you can just get the definitions here. Pharmacy abbreviations. HIV, human immunodeficiency virus. AMP, AMP, ampule. D5W, 5% dextrose in water. Sub-Q or SC, subcutaneous. Q, every. RX, prescription. PO, P.O. By mouth or orally. QT, quart. P.C. PC. It's not politically correct. It's after meals. PC. I think there's a Latin way to remember that. Post-consumption. PC. After meals. That's how I'm going to remember it. QID. 4 times per day. Always remember that because Q is like 4 quarters. QID. 4 times a day. UNG. Ung. Ointment. MCG. Microgram. MEQ. M capital E lowercase q. Milli equivalent. ML. Milliliter. NS. Normal saline. MG. Milligram. LR. Lactated ringers. Na plus. Sodium. NPO. Nothing by mouth. Capital L. Leader. K plus. Potassium. Ca plus plus. Calcium. Lowercase h. Hour. A dot C dot. AC. Before meals. GTT. Drop. AC before meals, it's like AM. C is consumption, before consumption. Lowercase g. Gram. LG. Immunoglobulin. Cl. Chlorine. GI. Gastrointestinal. BID. Twice a day. ATC in all caps. Around the clock. ATC around the clock. I wish they all matched like that. NDC. National Drug Code. MDI. Metered dose inhaler. OTC. Over the counter. IV. Intravenous. DISP. Disp. Dispense. TID. 3 times a day. 3 is T. BID, I remember by 2. 2 times a day. TPN. Total parenteral nutrition. Total parenteral nutrition. TPN. Total parenteral nutrition. Tab. Tablet. Sup. S-U-P-P. Suppository. Be an adult now, Tyler. Be an adult. SL. Sublingual. Under the tongue. ID. Intradermal. KG. Kilogram. INJ. Injection. SIG or Cigna. Instructions to the patient. So that's all the pharmacy abbreviations. All right. Get these ones on the side. Let's see. These are drug names and classifications. These are all drug names and classifications. There's a lot of these. All right. Make sure I get them all. I'm a perfectionist, completionist. We got to get them all. We got to get them in the right order. Look at these. We're about to do those. Whew. Okay. So, let me go through and sort these out here. This is what we got left. Doing y'all a favor. Free audiobook of a ton of note cards. Okay, those are pharmacy law. Pharmacy calculations, pharmacy law, more pharmacy calculations. Those are all pharmacy calculations. That one's the toughest part for me as an English teacher. Dimensional analysis, pharmacy law. Okay, they're almost the same color. Vitamins and minerals. Pharmacy law. Vitamins and minerals. Look like and sound alike drugs. Okay. Let's its own stack. General pharmacy terminology. Okay. Pharmacy calculations. General pharmacy terminology. Pharmacy calculations. Disease processes. Okay. I think I've sorted them all out. I'm going to see how long I can go without a drink. Well, in fact, I'm going to go get one just in case I get thirsty. Let's bust out another set. I hope this is live and working well. I can't check because my phone is working as my camera, so I could check it on another computer, but whatever. Says we're live, we're going for it. If anybody's listening, say something in the chat so you can hear me. Tell me you can hear me okay. You know what? I'll double check. Don't lose all this work. Sweet, it's working. I'll try to go back and timestamp this so you can skip that part if you want. It's not perfect, but we're gonna get it done. All right. Drug names and classifications. Brand. Amrix, Fexmid, Flexerol. Generic. Cyclobenzaprine, hydrochloride. Classification. Skeletal muscle relaxant, centrally acting. You know what? I think I'm gonna start that over. I think I want to do generic first, and then brand. Because in the pharmacy, I feel like you mostly see generic. But yeah, ours is organized by generic. Some are organized by brand. So we're going to start with generic. I'm going to do that one over again. Okay. Drug names and classifications. Generic. Cyclobenzaprine, hydrochloride. Classification. Skeletal muscle relaxant, centrally acting. Brand name. Amrix, Fexmid, Flexerol. Generic. Phenoldopam. Classification. Vasodilator. Brand. Corlopam. Generic. Procainamide. Procainamide. Classification. Anti-arrhythmic. Class IA. Brand. Pronestal. Generic. Benzapril hydrochloride. Classification. Antihypertensive ACE inhibitor. Its brand name, Lotinsin. Generic name, Divalproex sodium. Classification, anticonvulsant. Brand name, Depakote, Depakote ER. Generic, Metronidazole. Classification, trichomonoacid amibicide. Brand, Flagyl metronidazole. People make fun of me at work for not saying these right. All these names are made up. So, blame somebody in the boardroom. Generic, phenytoin sodium. Classification, antiarrhythmic. Class IB, anticonvulsant, hydantoin. Brand name, Dilantin. You know, I just realized the way these are set up is with the classification in the middle, it's going to throw you off. So the perfectionist in me, I'm going to do these again. I'm going to do the brand first. Brand, Amrix, Fexamid, Flexerol. Generic, cyclobenzaprine hydrochloride. Classification, skeletal muscle relaxant, centrally acting. Brand, Corlopam. Generic, Phenoldopam. Classification, vasodilator. Brand, Pronestal. Generic, Procainamide. Classification, antiarrhythmic, class IA. Brand, Lotensin. Generic, Benazepril hydrochloride. Classification, antihypertensive, ACE inhibitor. Brand, Depakote, Depakote ER. Generic, Divalproex sodium. Classification, anticonvulsant. Brand, Dilantin. Generic, phenytoin sodium. Classification, antiarrhythmic, class IB. Anticonvulsant, hydantoin. Brand, Flagyl, metronidazole. Metronidazole. Generic, metronidazole. Classification, trichomonacid. Amibacid. That's a hard one. Whew. Brand, NitroQuick, Nitrostat. Generic, nitroglycerin. Classification, vasodilator, coronary. Brand, Aventil, Pamelor. Generic, nortriptyline. Classification, antidepressant, tricyclic. Brand, Toprol XL. Toprol XL is manufactured by AstraZeneca. It's the 100 milligram and the 200 milligram. So Toprol XL, the generic is metoprolol succinate, succinate, however you want to say it. Metoprolol succinate. Classification, beta adrenergic blocking agent. Brand, Novolog. Generic, insulin aspart. Classification, insulin. Brand, Wycillin. Generic, penicillin G procaine. Classification, antibiotic. Brand, Biaxin. Generic, clarithromycin. Classification, antibiotic, macrolide. Biaxin is the brand, generic, clarithromycin. Classification, antibiotic, macrolide. Brand, Intol. Generic, Cromolyn sodium. Classification, anti-asthmatic drug. Brand, Mucomist. Generic, acetylcysteine. Classification, mucolytic. Brand, Hytrin. Generic, terazosin. Classification, antihypertensive alpha 1 adrenergic blocking drug. Brand, Hytrin. Generic, terazosin. Classification, antihypertensive alpha 1 adrenergic blocking drug. Brand, Singular. Generic, Montelukast sodium. Classification, anti-asthmatic leukotriene receptor antagonist. Brand, Lexapro. There's the 5 milligram, 10 milligram, 20 milligram. Lexapro is manufactured by Forest. Brand, Lexapro. Generic, escitalopram oxalate. Classification, antidepressant, selective serotonin reuptake inhibitor. Brand, Nexium. 20 milligram, 40 milligram. Nexium is manufactured by AstraZeneca. Brand, Nexium. Generic, esomeprazole magnesium. Classification, proton pump inhibitor. Brand, Prinavil Zestrol. Generic, lisinopril. Classification, antihypertensive, ACE inhibitor. Brand, Imitrex. Generic, sumatriptan succinate. Succinate. Classification, anti-migraine drug. Brand, Chantix. Generic, varenicline tartrate. Varenicline tartrate. Classification, smoking deterrent. Brand, Januvia. Generic, sitagliptin phosphate. Classification, anti-diabetic agent, dipeptidyl peptidase 4 inhibitor. Brand, Soma. Generic, carisoprodol. Classification, skeletal muscle relaxant, centrally acting. Brand, Cardia XT, Cardizem CD, Dilcor XR, Tazia XT. Generic, diltiazem hydrochloride. Classification, calcium channel blocker. Brand, Altase. Generic, Ramipril. Classification, antihypertensive, ACE inhibitor. Brand, Yasmin 28. Generic: ethanol, estradiol, and drospirenone. Classification: oral contraceptive. Brand: Zyprexa. Generic: olanzapine. Classification: antipsychotic. Brand: Digitech Lanoxin. There's the Lanoxin 0.125 milligram and Lanoxin 0.25 milligram. Lanoxin is manufactured by GlaxoSmithKline. Brand: Digitech Lanoxin. Generic: digoxin. Classification: cardiac glycoside. Digoxin. Brand: Boniva. 150 milligram. Boniva is manufactured by Roche. Generic: ibandronate sodium. Classification: bone growth regulator by bisphosphonate. Brand: Celexa. Generic: cetirizine. Classification: antidepressant, selective serotonin reuptake inhibitor. Brand: NuvaRing. Generic: etonogestrel, ethanol, estradiol, vaginal ring. Classification: contraceptive. Brand: Vasitec, enalaprilat. Generic: enalapril maleate. Classification: antihypertensive, ACE inhibitor. Brand: Zestoratec, Prinzide. Zestoratec, Prinzide. Generic: lisinopril and hydrochlorothiazide. Classification: antihypertensive, combination ACE inhibitor, and thiazide diuretic. Brand: Fulvite Deplin. Generic: for folic acid. Classification: vitamin B complex. Brand: Xenical with an X. Xenical. Generic: for orlistat. Classification: anti-obesity drug. Brand: Zyrtec. Generic: for cetirizine hydrochloride. Classification: antihistamine, second generation, piperazine. Brand: Phenidose, Phenergan, Promethazine. Generic: promethazine hydrochloride. Classification: antihistamine, first generation, phenothiazine. Brand: Acifex. Generic: rabeprazole sodium. Classification: proton pump inhibitor. Brand, Clarinex. Generic, Desloratadine. Classification, antihistamine, second generation, pauperidine. Brand, Seroquel. You got 25 milligram, 50, 100, 200, and 300 milligram. Seroquel is manufactured by AstraZeneca. Brand, Seroquel. Generic, quetiapine fumarate. Classification, antipsychotic. Brand, Protonix. Generic, pantoprazole sodium. Classification, proton pump inhibitor. Brand, Catapress Duraclon. Generic, clonidine hydrochloride. Classification, antihypertensive, centrally acting. Brand, Benicar. Generic, olmesartan medoxamol. Generic, olmesartan medoxamol. Try my best on that one. Classification, antihypertensive agent, angiotensin 2 receptor antagonist. Brand, Concerta, Metadate CD, Ritalin LA, Methylene. Generic for methylphenidate hydrochloride. Classification, CNS stimulant, and it's a C2. Brand, Spiriva Handyhaler. Generic, tiotropium bromide. Classification, anticholinergic. Brand, Adderall XR. 5 milligram, 10 milligram, 20 milligram, 30 milligram. Adderall XR is manufactured by Shire. Generic, amphetamine mixtures. Classification, CNS stimulant, C2. Brand, Paxil. Generic, paroxetine hydrochloride. Classification, antidepressant, selective serotonin reuptake inhibitor. Brand, Topamax. Generic, topiramate. Classification, anticonvulsant. Brand, Allegra. Generic, fexofenadine hydrochloride. Classification, antihistamine, second generation, piperidine. Brand, Synthroid, Levothyroid, Levoxyl, Thyrotabs, Tirosint, Unithroid. There's Synthroid 50 microgram, 75 microgram, 88 microgram, 100 microgram, 125 microgram, 150 microgram, and Synthroid 175 microgram. Synthroid is manufactured by Abbott. Its generic name is levothyroxine sodium. Its classification, it's a thyroid product. Brand, Anexia, Bandcap HC, Seta Plus, Kojesic, Dolaset, Duaset, Hyphen, Hyset, Hydraset, Hydrogesic, Liquiset, Lorsdet Plus, Lorset, Lortab, Margesic H, Maxidone, Norco, Panaset, Stragesic, Tgesic, Vicodin, Vicodin ES, Vicodin HP, Zodol, Zydone. Generic. Hydrocodone / acetaminophen. Classification analgesic. It's a C3. Brand Lipitor. It comes in 10 milligram, 20 milligram, 40 milligram, and 80 milligram varieties. Lipitor is manufactured by Pfizer. Generic atorvastatin, calcium. Classification anti-hyperlipidemic HMG/CoA reductase inhibitor. Brand ISMO, ISMO, Monoket IMDUR, IMDUR. Generic isosorbide mononitrate. Classification coronary vasodilator. Brand Lasix, 80 milligram. Lasix is manufactured by Sanofi. Its generic name is furosemide. Classification loop diuretic. Brand Coumadin, Jantovin. There's Coumadin 1 milligram, 2 milligram, 3 milligram, 4 milligram, 5 milligram. Coumadin is manufactured by Bristol Myers. I always think of this as rat poison. And what is the generic name for rat poison? It is warfarin sodium. Classification anticoagulant. Coumarin derivative. Eliquis is still under patent, if you wonder why the poor take this still. Let's keep politics out of our flashcards. Brand Crestor, 5 milligram, 10 milligram, 20 milligram. Crestor is manufactured by AstraZeneca. It's generic for rosuvastatin calcium, and its classification is anti-hyperlipidemic HMG/CoA reductase inhibitor. Brand Effexor XR. Effexor XR comes in 37.5 milligram dose, 75 milligram dose, and 150 milligram dose. Effexor XR is manufactured by Wyeth, and its generic name is venlafaxine hydrochloride. Its classification antidepressant. Brand name Diavin comes in 80 milligram, 160 milligram, and 320 milligram doses. Diavin is manufactured by Novartis. It's generic for valsartan. Classification antihypertensive, angiotensin II receptor blocker. Brand Norvasc, Amvaz. Its generic name is amlodipine. Classification calcium channel blocker. Brand Zithromax, azacite ophthalmic solution, Zmax. Generic azithromycin. Classification antibiotic, macrolide. A Z-Pack. Brand Lepressor. Generic. Metoprolol tartrate. Classification: beta adrenergic blocking agent. Brand: codeine. Generic: codeine sulfate. Classification: narcotic analgesic. It's a C2. Brand: Naftin. Generic: naphthalene hydrochloride. Classification: antifungal agent. Brand: Demerol. Generic: meperidine hydrochloride. Classification: narcotic analgesic. It's a C2. Brand: Combivent Duoneb. Its generic name is epitropium bromide and albuterol sulfate. Its classification: it's a cholinergic blocking drug and sympathemimetic. Whew. Brand: Advair Discus. Its generic name is fluticasone, propionate, and salmeterol. Classification: anti-asthmatic. Brand name: diazide maxide. Its generic name is triamterene and hydrochlorothiazide. Classification: antihypertensive combination drug. Brand: Glucotrol. Glucotrol XL. Its generic name is glipizide. Its classification: it's an anti-diabetic, oral second generation sulfonylurea. Brand: Medrol. Its generic name is methylprednisolone. Classification: it's a glucocorticoid. Brand: Calan, Cover HS, Isoptin SR, Verilin. Its generic name is Verapamil. Classification: calcium channel blocker. Brand: Darvin In. Its generic name is propoxyphene napsylate. Classification: narcotic analgesic. It's a C4. Brand: Dorix, Atrodox, Periostat, Vibratabs, Vibramycin. Its generic name: doxycycline hyclate. Classification: it's an antibiotic or a tetracycline. Brand: Dirinium. Its generic name is triamterene. Classification: diuretic, potassium sparing. Brand: Prim Pro. It's generic: conjugated estrogens and medroxyprogesterone acetate. Classification: sex hormones. Brand: Lantus. Generic: insulin glargine. Classification: insulin. Brand: Ambien, Ambien CR, Tovalt, ODT. Ambien comes in 5 milligrams, 10 milligrams, constant release 6.25 milligrams, and constant release 12.5 milligrams. I think that's what CR means. Ambien is manufactured by Sanofi, and its generic name is Zolpidem tartrate. Classification: sedative, hypnotic, non-benzodiazepine. C4. I always think of this as the Roseanne drug. I love you, Roseanne. It's a popular one. You ain't alone, girl. Brand: Nasonex. Generic: mometazone furoate monohydrate. Classification: glucocorticoid. Brand: Ultram, Ultram ER. Its generic name is tramadol hydrochloride. Classification: analgesic, centrally acting. Brand: Tricor, Lipofen, Antera, Low Fibra, Triglide. Its generic name is phenofibrate. Its classification: anti-hyperlipidemic. Brand name: Zetia. Generic: Easytimib. Classification: anti-hyperlipidemic. Brand: Prozac, Serafam Pulvules. Generic: fluoxetine hydrochloride. Classification: antidepressant, selective serotonin reuptake inhibitor. Brand: Deltazone. Generic name: prednisone. Classification: glucocorticoid. Brand: Tenormin. Its generic name: atenolol. Classification: beta adrenergic blocking agent. Brand: Levaquin or Quixin. Levaquin comes in 250 milligram, 500 milligram, and 750 milligram doses. Levaquin is manufactured by Otho McNeil, and its generic name is levofloxacin. Classification: antibiotic, fluoroquinolone. Levofloxacin is what I always call it in my head. Floxacin. Diovan HCT is the brand name. Generic name is valsartan and hydrochlorothiazide. Classification: antihypertensive, combination drug. The brand name here is Flomax, 0.4 milligrams. Flomax is manufactured by Boehringer, and its generic name is tamsulosin hydrochloride. Classification: alpha adrenergic blocking drug. Brand: Actos. Comes in 15 milligram, 30 milligram, and 45 milligram doses. Actos is manufactured by Takeda, and its generic name is pioglitazone hydrochloride. Classification: anti-diabetic, oral, thiazolidinedione. Say that 3 times fast. Brand: Xanax, Niravam. Its generic name is alprazolam. Classification: anti-anxiety drug, benzodiazepine, and it's a C4. Favorite of suburban wine moms around the world. Ask your doctor. Brand, Prevacid, 30 milligram. Prevacid is manufactured by TAP. It's generic for lansoprazole, and its classification, proton pump inhibitor. Shouldn't take that with alcohol, by the way. Officially. Bad news. Brand, Niaspan, Niacor. Its generic name is niacin. Classification, vitamin B complex. It'll kill you. It's not really a joke. It's not a joke. All right. I'm getting bored. I'm starting to comment on these drug names. Can't have that. Shut up and read them. Brand, Chlorcon M20. Generic, potassium salts. Classification, electrolyte. I used to think I had ADHD. If I'm able to sit here and read this all the way through, I don't think that's possible. Brand, Avapro, 150 milligram and 300 milligram doses. Avapro is manufactured by Bristol Myers, and its generic name is irbesartan. Classification, antihypertensive, angiotensin II receptor blocker. Brand, Elavil. Its generic name is amitriptyline hydrochloride. Classification, antidepressant, tricyclic. Brand, Trinessa 28. Its generic name is ethinyl estradiol and norgestimate. Classification, oral contraceptive. Brand name, Zantac. Its generic name is ranitidine hydrochloride. Its classification, histamine H2 receptor blocking drug. Brand, penicillin VK, VTIDS. Its generic name is penicillin V potassium. Classification, antibiotic, penicillin. Brand, colchicine injection. Colchicine injection? Colchicine tablets or colchicine tablets. It's brand. Its generic name is colchicine or colchicine. Classification, anti-gout drug. I think I'd say colchicine in my head. Colchicine. Brand, Cytotec. Generic name, misoprostol. Classification, prostaglandin. Brand, Pepsid. Generic, famotidine. Classification, H2 receptor antagonist. Brand, Cialis. Comes in 10 milligram and 20 milligram pills. Cialis is manufactured by Eli Lilly, and its generic name is Tadalafil. Classification, it's a drug for erectile dysfunction. I always call it Tadalafil. Tadalafil. Viagra's competition right there. Brand, Oxycontin, one of America's favorites. Thank you, Sackler family. And its generic name is oxycodone hydrochloride. Classification, narcotic analgesic. And it's very much a C2 scheduled drug. Wish all the generic names were that easy, don't you? Oxycontin, oxycodone. Ah, that would be nice. But alas, they want us to feel like we learned something tonight. Augmentin, Augmentin ES, Augmentin ER, Amaclan. Its generic name is amoxicillin and potassium clavulinate. Its classification, it's an antibiotic, penicillin. Brand name, Tylenol with codeine. Generic name is acetaminophen and codeine. Classification, non-narcotic, narcotic, analgesic combination. And it's a C3. That's why it's called Tylenol 3. Brand, Lotrel. Generic, amlodipine, besylate, and benazepril. Classification, antihypertensive. Brand, Valtrex. Generic, valacyclovir hydrochloride. Classification, antiviral. Another favorite of the 90s here. Brand, Viagra, Revatio. Viagra comes in 50 milligram and the Big Daddy 100 milligram pill. Viagra is manufactured by Pfizer. Very popular these days. Generic, sildenafil citrate. Classification, drug for erectile dysfunction. Drug for pulmonary arterial hypertension. You don't hear that second one very much. Everyone is a teenager. Brand, Actonel. Generic, risodronate sodium. Classification, bone growth regulator. Bisphosphonate. Brand, Prilosec, 40 milligram tablet. Prilosec is manufactured by Procter & Gamble. And its generic name is omeprazole. Classification, proton pump inhibitor. For serious tummy issues. Brand name, Yaz28. Its generic name is ethinyl estradiol drospirenone. Classification, it's monophasic oral contraceptive. Brand, Neurontin, Gabaron. Its generic name is gabapentin. Its classification, anticonvulsant. Brand, Fosamax, 10 milligram tablet. Fosamax is manufactured by Merck. Its generic name is alendronate sodium. Classification, bone growth regulator, bisphosphonate. Brand name, Hyzar. Its generic name is losartan, potassium, and hydrochlorothiazide. Classification, antihypertensive. Combination, angiotensin II receptor blocker and thiazide diuretic. Brand name, Naproxen. Its generic is naproxen. Classification, non-steroidal anti-inflammatory. Brand name, Lamictal. Its generic name is lamotrigine. Classification, anticonvulsant. Brand name, Detrol or Detrol LA. It comes in 1 milligram and 4 milligram tablet and capsule, respectively. Detrol LA is manufactured by Pfizer. Generic, tolterodine tartrate. Classification, urinary tract drug. Brand, Acupril. Its generic name is quinapryl hydrochloride. Its classification is antihypertensive ACE inhibitor. Brand, Kozar. Comes in 25 milligram, 50, and 100 milligram tablets. Kozar is manufactured by EI DuPont de Nemours. Its generic name is losartan potassium, and its classification, it's an antihypertensive angiotensin II receptor blocker. Brand, Tamiflu. Generic, oseltamivir phosphate. Classification, antiviral agent. Brand, Risperdal. Its generic name is risperidone. Its classification is antipsychotic. Bunch of people on YouTube need that. Maybe me. Brand, Buspar. Generic, buspirone hydrochloride. Classification, anti-anxiety drug, non-benzodiazepine. Brand, Mobic. Its generic name is meloxicam. Its classification is it's a non-steroidal anti-inflammatory. I feel like I see a lot of meloxicam in pharmacy. Brand, Vancomycin. Its generic name is vancomycin, and its classification, it's an antibiotic. Brand name, Cymbalta. Its generic name, duloxetine hydrochloride. Its classification, it's an antidepressant, selective serotonin and norepinephrine reuptake inhibitor. Brand, Flonase or Flovent. Its generic name is fluticasone propionate, and its classification is it's a glucocorticoid. Brand, Ativan. Another American favorite. Its generic name is lorazepam. Its classification, anti-anxiety, benzodiazepine, and it's a C4. Part of the hospice cocktail. That and a little morphine. Brand, hydrodiol ezide hydropar microzide capsules. Generic name, hydrochlorothiazide. Classification, diuretic, thiazide. Brand, Budeprion XL, Aplazin, Wellbutrin, Wellbutrin SR, Wellbutrin XL, and Zyban. Its generic name is bupropion. I always say bupropion. Hydrochloride. Classification, antidepressant, smoking deterrent, Zyban. Brand, Alloprim for injection, Xyloprim. Its generic name is allopurinol. Classification, anti-gout drug. Brand, Glucophage XR, Fortimet, Glumetiza, Riomet. Its generic name is metformin hydrochloride. Its classification, anti-diabetic, oral biguanide. Brand, Zoloft, another American favorite. I'm gonna quit saying that. All these are American favorites. It's the only thing we make in this country anymore. Brand Zoloft, 25 milligram, 50 milligram, both tablets, manufactured by Pfizer. And the generic name is sertraline hydrochloride. Classification, antidepressant, selective serotonin reuptake inhibitor. Pharmaceutical drugs and weapons we ship overseas. That's the American manufacturing sector at this point. China makes everything else. Brand, Amoxil, Dispermox, Moxitag, Trimox. Generic name, amoxicillin. Classification, antibiotic, penicillin. Brand, Celebrex. Comes in 100 milligram and 200 milligram capsules. Celebrex is manufactured by Pfizer. Its generic name is Celecoxib. Classification, non-steroidal anti-inflammatory COX-2 inhibitor. I think this one is no longer on the market, if I remember correctly. Pfizer. Went the way of Vioxx. Safe and effective, says the FDA. Or used to. Darvocet in, Propicet, Tricet. That's the brand names. Its generic name is propoxyphene napsylate / acetaminophen. Classification, narcotic and non-narcotic analgesic combination. And it's a C4. Brand, Klonopin, Rivotril. It's my favorite Eminem line. Swallowing the Klonopin while I'm nodding in and out on the ottoman at the Ramada, and then I reach for the pill bottle then. What is Klonopin's generic name? It's clonazepam. Classification, anticonvulsant. And it's a C4. Brand, Motrin, Advil, Nuprin. I bet you at home can get this one. Its generic name is ibuprofen. Classification, non-steroidal anti-inflammatory. Brand name, Aricept. Its generic name is donepezil hydrochloride. Classification, treatment of Alzheimer's disease. Brand, Lyrica. Its generic name, pregabalin. Classification, anticonvulsant. And it's a C5. Brand, neosynephrine. Its generic name, phenylephrine hydrochloride. Classification, nasal decongestant. I could use one of those right now if it didn't make me feel so weird. They open me up. They always make me feel awful. Brand, Levodopa. Its generic name, Levodopa. Classification, anti-Parkinson drug. Get that dopamine up. That's how I remember it. Dopamine, dopa. Brand, Depakine. Its generic name is valproic acid. Its classification, anti-seizure drug. Brand, Avalox, Vigamox. Avalox 400 milligram capsule. Avalox, Aviolox is manufactured by Bear Schring. Its generic name is monofloxacin hydrochloride. Classification, antibiotic, fluoroquinolone. Brand, Vytorin. Its generic name is ezetimibe, and simvastatin. Ezetimibe and simvastatin. Let's try that one again. Its classification, combination, anti-hyperlipidemic. Brand, Vytorin. Its generic name is ezetimibe and simvastatin. Classification, combination, anti-hyperlipidemic. Brand, ProAir HFA, Acuneb, Proventil, Ventolin, Vospire ER. Its generic name is albuterol. Its classification, sympathomimetic, anti-asthmatic drug. Brand, Zocor. Its generic name is simvastatin. Its classification, it's an anti-hyperlipidemic HMG/CoA reductase inhibitor. Brand name, Pravachol. Its generic name is pravastatin sodium. Classification, anti-hyperlipidemic HMG-CoA reductase inhibitor. Brand, Percocet, Indocet, Magnicet, Perlox, Rixacet, Rixalox, Tylox. Generic name, generic oxycodone and acetaminophen. Its classification, it's an analgesic and it's a C2. Brand name, Keflex. Its generic name, cephalexin. Classification, cephalosporin, first generation. We do a lot of that in the pharmacy. Cephalexin. I have to look up what a cephalosporin is. Brand, Septra, Bactrim, Cotrim, Sulfatrim. Generic name, trimethoprim and sulfamethoxazole. Trimethoprim and sulfamethoxazole. Classification, antibiotic, combination. Bactrim. This brand name, Ticlid. Generic, ticlopidine hydrochloride. Classification, antiplatelet drug. Brand name, Avandia. Its generic name, rosiglitazone. Classification, anti-diabetic, oral, thiazolidinedione. Brand, Procardia, Procardia XL, Adalat, Adalat CC, Afedetab CR, Nefeticol XL, and its generic name is nifedipine. Its classification, it's calcium channel blocker. Brand, Cardura, Cardura XL. Its generic name is doxazosin mesylate. Its classification, it's an antihypertensive peripherally. Brand name, Avista, 60 milligram tablet. Vista is manufactured by Eli Lilly, and its generic name is raloxifene hydrochloride. Classification, estrogen receptor modulator. Brand, Arrestin, Clearview M, Dynacin, Minacin, Myrac, Solidin. Generic name, minocycline hydrochloride. Classification, antibiotic, tetracycline. Brand name, Zovirax. Its generic name, acyclovir. Classification, antiviral. Brand name, Premarin. Comes in 0.3 milligram, 0.625 milligram, and 0.9 milligram tablets. Premarin is manufactured by Wyeth, and its generic name is conjugated estrogens. Classification, estrogen, natural, and synthetic. Premarin is estrogen. Brand, Inderal, Inopran. Its generic name is propranolol hydrochloride. Its classification, it's a beta adrenergic blocking agent. Beta blocker, blood pressure, anxiety. Brand, Ziac. Ziac? Ziac. Its generic name is bisoprolol fumarate and hydrochlorothiazide. Its classification, antihypertensive. Brand, Cipro, Siloxan, ophthalmic, Proquin. Its generic name is ciprofloxacin hydrochloride. Classification, antibiotic, fluoroquinolone. Cipro. Brand name, Lunesta, 3 milligram tablet. Lunesta is manufactured by Seprecor. Its generic name is Ezopiclone. Ezopiclone. Classification, it's a sedative, hypnotic, non-benzodiazepine. It's a C4. Looks like sleepy time. Lunesta. Ezopiclone. It's a hard one to remember. Generic. Brand, Ortho Tricycline Low. Its generic name is ethinyl estradiol and norgestimate. Classification, oral contraceptive. Brand, Abilify. This one I always think gives you better abilities. Let's see what abilities it gives us. Generic is aripiprazole, and its classification is antipsychotic. So it gives us the ability to not become psychotic. Aripiprazole, Abilify, antipsychotic. Diflucan, brand name Diflucan. Its generic name is fluconazole, and its classification, it's antifungal. Brand name Valium, Diastat, Acudial, diazepam, and tinazole. Its generic name is diazepam. Classification, anti-anxiety, benzodiazepine, C4. It's always amazed you could take this in the game Metal Gear. Steadied your nerves. That, or you could smoke cigarettes, but you don't want to do that. That's bad for you. So it's recreational diazepam. Don't do it. Ask your doctor. Get a prescription. Brand, Zalatan. Generic, latanoprost. Classification, prostaglandin agonist. Brand name, Diabeta. Glinase Prestab. Micronase. Generic, glyburide. Classification, anti-diabetic. Oral, second generation. Sulfonylurea. Brand, Chlorves, Kdur, K-Tab, Chlorcon. Generic name is potassium chloride. Classification, it's an electrolyte. Potassium. Gatorade. What's that from Idiocracy? It's got what plants crave. I can't remember. Brondo. I don't know. Someone will say it in the comments. Brand, Plavix. 75 milligram tablet. Plavix is manufactured by Bristol Myers, and its generic name is clopidogrel. Classification, it's an antiplatelet drug. And that's all of the drug names and classifications. We just went through this many cards. Check this out. Check this out. Whew. I'm going to do a little organizing here. Take a slight break from that mind-numbing reading. It's like I said, studying for this kind of thing. I mean, how's that going to soak in? That's why I thought maybe I'll have a video. So later it gets more honest, I'm going to tell you. I'm taking this test tomorrow at 1:30. And a lot of the people that I know never studied at all for it. You work in a pharmacy long enough, you kind of know, you know. But I figured I'd study till midnight and try to get as much of this done as I can. If I can't get the test in, I'll just take it tomorrow. I'll tell you how I do. If I pass it, won't worry about it. I might show it to you, but if I need to take it again, we'll do the test again. All right. So I got all these. Whew. That one was a doozy. That stack's like 5 times bigger than the other 2 stack. All right. Let's get another stack. Let's do an easy one. The natives are getting restless. You know what? I want to dive right into another big stack. I'm going to do them biggest to smallest. I'm going to attack these suckers. Like Mark Twain said, if you got to eat a frog, it's best to eat it at 10:01 p.m., I guess. That's not what he said. He said in the morning. Oh, this light makes me look like I'm just worked at McDonald's all day. I'm 36. I don't know. Need some powder for this here. Okay, now we're doing look-alike and sound-alike drugs. Look-alike and sound-alike drugs is our next culprit. Here we go. Tramadol may be confused with trazodone. Vinblastine may be confused with vincristine. Lipitor, Zantac, Zocor, Zyprexa, Zyrtec D. Zyrtec may be confused with Lipitor, Zantac, Zocor, Zyprexa, Zyrtec D. Zantac may be confused with Xanax and Zyrtec. Novolin may be confused with Humulin and Novolog. Oxycodone may be confused with hydrocodone and Oxycontin. Prilosec may be confused with Prozac. Tiagabine may be confused with tizanidine. Retrovir may be confused with ritonavir. Benazepril may be confused with Benadryl. Diprovan may be confused with Ditropan. Sounds like I'm making up words. Lunesta may be confused with Neulasta. Atacand may be confused with antacid. Advair may be confused with Advocor, may be confused with Advair. Folex is a sound-alike drug with Foltix. Hydrocodone may be confused with oxycodone. Casodex is a sound-alike drug with Capodex. Fomepizole may be confused with omeprazole. Darvocet may be confused with Percocet. Ritalin may be confused with Ritodrine. Celexa may be confused with Zyprexa, Celebrex, Cerebex. Sinequan, here we go. Singular may be confused with Sinequan. Avinza may be confused with Invans Avista. Cardua may be confused with Coumadin. Clonidine may be confused with Klonopin. Diflucan may be confused with Diprivan. Donorubicin may be confused with Donorubicin citrate liposomal doxorubicin idarubicin. Amphotericine B may be confused with Abelset ambiosome. Acetazolamide may be confused with actohexamide. Actohexamide. Alprazolam may be confused with lorazepam. Avandia may be confused with Coumadin, Prandin. Amicar may be confused with Omicor. Leuceron may be confused with leucovorin calcium. Metformin may be confused with metronidazole. Morphine may be confused with hydromorphone. Mucinex may be confused with Mucomist. Those both don't sound very appetizing. MS-Contin may be confused with OxyContin. Ephedrine may be confused with epinephrine. Heparin may be confused with Hespan. Humalog may be confused with Humulin Novolog. Iodine may be confused with Lodine. Duracef is often confused with Ultracet. Colchicine is a sound-alike drug with Cortrosyn. Mirapex may be confused with Miralax. Laxative. Miralax. Linoxin is commonly confused with both levothyroxine and naloxone. Zetia may be confused with Zebeda, Bextra, Zestrol. Narcan may be confused with Norcuron. Diabeta may be confused with Zebeda. Zyban is a sound-alike drug with Diovan. Acifex may be confused with Acupril or Aricept. Cidex is a sound-alike drug with Cdax. Adderall is a sound-alike drug with Inderall, Adderall XR. That one seems silly. Of course, XR, it's the same word. Flonase may be confused with Flovent. Methadone may be confused with methadone. Noroxin may be confused with Neurontin. Lonitin may be confused with Lotinsin Lipitor. Lasix may be confused with Luvox. Metadate may be confused with methadone. Metadate sounds like a Pokemon. Allegra may be confused with, boy, you wouldn't want this one, Viagra. Don't confuse Allegra with Viagra. Be a bad evening. Or a good evening, I don't know. However you look at it. Januvia may be confused with Injuvia, Jantavin, Janumet. Patanol may be confused with Platinol. Norvasc may be confused with Navane. Orencia may be confused with Rifatin may be confused with Riffetair. Reminal may be confused with Emerald. Robinal. Spiriva may be confused with Inspra. Vexil is a sound-alike drug with Vosol. Lamivudine may be confused with Lamotrigine. Hydroxyzine may be confused with hydralazine, hydrogesic. And finally, Topamax may be confused with Toprol XL. So we're done with look-alike and sound-alike drugs. Hey, made it. Little commentary in between here. Pharmacists definitely deserve to be paid more than techs, but it's like hard to even wrap your mind around how much more they get paid. I mean, they need the insurance. They make the final check, but I will say a good tech can make or break your experience at the pharmacy. A tech that's worked there for 20 years can work absolute miracles. Sometimes you'll have a genius pharmacist, but they just are having a bad day and they don't want to help you. That happens sometimes. I don't want to put anybody on blast, but I mean, this is like my second gig. I'm a teacher full time, but pharmacy techs deserve more. And I think they should come together in a don't want to say you could get more pay real quick, and it's an unbelievable pressure point. Because if you have a nationwide you can get whatever you want. Because the whole thing comes down. It's like just a thought. It's a thought. Oh, I love the State of the Union. Not a bad idea. Okay, let's pick another one. Disease processes. Let's try that. Oh, I have this one in my left ear. Old lifeguard injury. Let's get this back going. There we go. All right. Disease processes. A ringing in the ears is called tinnitus. Okay, I did this one backwards. A disease process that decreases a person's ability to ventilate. Chronic obstructive pulmonary disease, COPD. A disease characterized by constriction and spasm of the airways. Asthma. What condition results from the hypersecretion of human growth hormone after puberty? Acromegaly. Acromegaly. Gotta look that one up. What disorder affects African Americans and causes red blood cells to become crescent-shaped, rigid, sticky, and fragile, resulting in chronic anemia? Sickle cell anemia. Oh boy. Mr. R.F. Kennedy. He got in trouble for saying something similar about God. It's funny. It's literally a flashcard. All right. Athlete's foot is otherwise known as tinea pedis. A friend told me when I was like 5th grade basketball, he's like, if you dry real good in between your toes when you get out of the shower, you'll never get athlete's foot. And he was so right. Thank you, Nathan. I never got athlete's foot again. Brilliant. His mom's a pharmacist. She'd be proud. A complex psychological state characterized by the fear of being overweight is called anorexia nervosa. Isoniazid, INH, pyrazinamide, PZA, and rifampin, RMP, are commonly used to treat this infectious respiratory disease. Tuberculosis. I'm glad they've about whipped that one. A decreased number of circulating red blood cells, hemoglobin, or both may cause anemia. Abnormal thinning of the bones, producing a porous and fragile bone tissue, is called osteoporosis. A disease process caused by hemorrhage in the brain. Stroke. A chronic disorder resulting from the inadequate production of insulin. Diabetes mellitus. Myocardial infarction is also known as I know this one, heart attack. Atopic dermatitis is a chronic skin lesion characteristic of an allergic reaction that is referred to as eczema. A severe pain in the chest, commonly caused with heart disease. Angina. A condition characterized by higher than normal blood pressure. Hypertension. I don't know if it was angina or angina. I don't know. Embarrassing yourself on the internet's half the fun, especially in a way that can be brought up forever. An abnormal immune response to a particular stimulus. Allergy. Elevation of pressure within the eye that may cause blindness is referred to as glaucoma. Everybody's favorite excuse for the wacky weed. Iodine deficiency may cause goiter. I've never so we gonna smoke it though. Couldn't you just take Marinol? It's been on the market for years. Inflammation of the skin is called dermatitis. Bleeding between menstrual periods is called metrorrhagia. Metrorrhagia. Rapid movement of the eyeball is known as nystagmus. A component of hemoglobin is iron. Osteoporosis may be caused by calcium deficiency. Intermittent short periods of breathing cessation during sleep are referred to as sleep apnea. Sudden, unexpected cessation of cardiac activity is called cardiac arrest. German measles is also known as rubella. Low blood sugar is called hypoglycemia. Varicella is a highly contagious viral infection that is also called chickenpox in children or shingles in adults. A substance or agent that causes cancer is called an carcinogen. It's kind of interesting how you know some of these already. It's because you hear them all the time. That's why. It doesn't really make sense to know one and not the other, but it's because you've heard it a lot. A stretching or a partial tear in a muscle or a muscle tendon unit is called an strain. The inability to fall asleep is referred to as insomnia. An area of necrotic tissue that has been invaded by bacteria is known as gangrene. Herpes zoster is also called shingles. An area of dead cells due to lack of oxygen is called an infarction. A cancer of the epithelial cells is called an carcinoma. Diverticulitis occurs particularly in the colon. Hashimoto disease is a chronic disorder of the immune system that attacks the thyroid gland. Looks like a Japanese disease. I wonder if it's Hiroshima. I have to look it up. An imbalance of acetylcholine and dopamine in the brain can cause Parkinson's disease. I heard somewhere before that smoking prevents Parkinson's disease. I don't know if that's true. Of course, it kills you in like 78 other ways, so I wouldn't recommend it, but I thought it was interesting. The most common type of anemia in the United States is iron deficiency anemia. And that's the end. Yeah, it had something to do with nicotine, like in dopamine reuptake, synthetic analog. I can't remember exactly. How many more we got? 4 more stacks. That stack's not too bad. That stack's not too bad. This stack is pretty bad, and it's math. Ooh. There you go. I think I'm going to save the math for last. I said I was going to eat that frog, but I'm not. Not with math. So, I'm going to go blow my nose. We'll get back. We'll do another stack. All right? We've been at this 2.5 hours of studying. All right. Nose blown, bathroom used. kiss the kids and the wife. I've done it all. Let's do 2.5 more hours of riveting pharmaceutical study. You ready? I'm ready. Okay. All right. Let's do these. These are vitamins and minerals. Vitamins and minerals. Here we go. Fat-soluble vitamins include vitamins A, D, E, and K. The two functions of vitamin K include blood clotting and bone development. Iron toxicity from a single large dose, 20 to 60 milligrams per kilogram, can be fatal. Vitamin B12 is also referred to as cyanocobalamin. Cyanocobalamin. I'm just going to call it vitamin B12. Chronic or abusive use of alcohol can interfere with absorption of thiamine. Most of the body's calcium, more than 99%, is found in the bones and teeth. That's interesting. I didn't know that. 99% of the calcium is in your bones and teeth. I knew it was good for them. Potassium is the major electrolyte controlling water inside cells, intracellular water or fluid. Vitamin B12 is essential for normal blood formation and proper nervous system function. A vital organic dietary substance that is not a carbohydrate, fat, protein, or mineral is called an vitamin. Get your vitamins. I used to take Fred Flintstone. Orange. Tasted not very good. I chewed it up. It was okay. Diabetes mellitus salts that break up into their separate component particles in water are called electrolytes. I think I remember hearing that Fred Flintstone vitamins were bad for some reason, but I think I turned out okay. I don't know. Inorganic substances that the body needs to help build and maintain tissues are called minerals. Water-soluble vitamins include the vitamin B complex and vitamin C. The main function of fluoride in human nutrition is to prevent dental caries. Is that another word for cavities? The most common symptom of selenium toxicity is brittleness in both the hair and nails. Beta carotene can be converted. Beta carotene can convert to vitamin A. Carrots. Dietary vitamin A deficiency is the #1 cause in children of blindness. Wow. I remember saying Accutane was like a giant dose of vitamin A. I don't know. I'll have to look it up. Vitamin B3 is also known as niacin. The vitamin that helps heal wounds and protect against infections is vitamin C. Overdose of vitamins is called hypervitaminosis. That's a fun word. Hemorrhage may be caused by deficiency of vitamin K. People sleep on vitamin K. Heard it's important. Heard it helps with your arteries being blocked or something. Clears out the calcium deposits. I don't know. I just heard that. Dr. Berg. Vitamin C is also known as ascorbic acid. Pernicious anemia is caused by the inability to absorb which vitamin from the diet? Vitamin B12. A deficiency of vitamin C may result in RDR, mateys, scurvy. Vitamin D deficiency in children may cause rickets. Get your kids outside. The best sources of vitamin C are Flintstone vitamins. No. Fruits and vegetables. For example, potatoes. Potato high in vitamin C? Of all the fruits and vegetables, I never would have thought potatoes. But, all right. Vitamin B9 is also known as folic acid. Well, you don't hear much about B9, do you? Fat-soluble vitamins, especially vitamin A, can be stored in large amounts in the liver. Phosphorus serves as a partner with calcium in the major task of bone formation. Phosphorus and calcium, bone formation. The greatest sources of dietary zinc are meat and oysters. How about that? Women on extensive exercise programs such as marathons may have increased requirements for the vitamin known as riboflavin. Get your riboflavin. The vitamin that is recommended for supplementation at birth is vitamin K. Don't sleep on vitamin K. Riboflavin is also referred to as vitamin B2. Dwarfism, delayed growth, hypogonadism, anemia, and decreased appetite are symptoms of a deficiency of the mineral called zinc, another name for tocopherol is vitamin E. The primary reaction from high doses of niacin is flushing. Vitamins are traditionally classified as either fat soluble or water soluble. The trace mineral that is a key element in hydrochloric acid secreted in the gastric juices is chloride. A mild deficiency of vitamin A may cause night blindness. Man, your eyes need that vitamin A. Excess sodium intake has been linked to hypertension, high blood pressure. And finally, on the vitamins, the two vitamins known as antioxidants are vitamins C and E. Antioxidants kill dead cells. Am I right? I think so. I don't know. Maybe. It's the end of the vitamins. We've done 6 stacks out of 9. 3 stacks of cards left. Outside the math, the brand generic name was by far the most difficult. All right. Let's do... Okay. Let's do this little stack. This stack is general pharmacy terminology. General pharmacy terminology. All right. A condition of being free of all microorganisms is described as sterile. A mixture of nutrients that can be injected as an IV solution and is used for patients who cannot consume a normal diet is referred to as total parenteral nutrition, TPN. The stock of medication immediately on hand in a pharmacy is called inventory. An inactive substance given in place of a medication is referred to as an placebo. The inside diameter of a needle is called the lumen. An agent that relieves pain is called an analgesic. A syringe or similar device containing a predetermined amount of medication is described as pre-filled. A solution used for washing a body surface or cleaning out a wound is called an irrigation. Cleaning out a wound, irrigation. The abbreviation USP means United States Pharmacopoeia. Pharmacopoeia. USP. United States Pharmacopoeia. A room located immediately outside of a clean room is called an anteroom. What kind of number is assigned by the manufacturer for identification of the batch of bulk drug products from which a medication was prepared? Lot number. What do you call the amount or concentration of a drug contained in 1 unit or dosage form? Dosage strength. The outside diameter of a needle is called the gauge. What is the amount of medication that is to be administered to a patient? The dose. The preparation and distribution of medications is referred to as dispensing. Machinery used to perform tasks otherwise performed by humans is referred to as automation. In the practice of pharmacy medications, unit doses may be prepared by an automated dispensing machine. Never seen those, I've heard about them. Sounds like something they do in Japan. Agents that induce sleep are called hypnotics. That's an easy one to remember. A clear liquid made up of one or more substances dissolved in a solvent is referred to as an solution. The directions for use that must be printed on the prescription label are collectively referred to as the signature, abbreviated SIGNA or SIG. A drug that is not pure is referred to as an adulterated drug. The term bolus means an initial dose. A bolus, initial dose. A personal monitoring device that measures an individual's exposure to radiation is called an dosimeter. I thought it was a Geiger counter. It's a dosimeter. The study of cancer is referred to as oncology. It's a nice name for it. Makes it sound better than cancer. The term half-life is abbreviated as T1/2. Half-life refers to the amount of time it takes for half of a substance, drug, to break down in the body. the action of a drug increasing the effects of another drug so that the combined effect is greater than the sum of the effects of each drug alone is called potentiation. Particulates of medication contained within a gaseous spray are referred to as an aerosol. The action taken to remove a drug from the market is called an recall. An order for medication to be administered immediately is called an stat order. An oil-based medication enclosed in a soft gelatin capsule is called an gel cap. The process of grinding particles to reduce particle size is known as trituration. Okay, so we're done with that one. General pharmacy terminology. Done. 2 stacks left. I'm going to leave math for the end because I feel most people will probably need to watch that one the most so they can find it easy by just going to the end of these. All right. Green ones. Make sure I got them all in the box. Yep, these are just note cards. Okay. All right. These are pharmacy law. Pharmacy law. How many times may Accutane prescriptions be refilled? 0. Restrictions on Accutane are implemented due to high incidences of the drug causing birth defects and fetal deaths. I wonder if one of them is blindness because of vitamin A. There's kids born without eyes and stuff with Accutane. How many controlled substances schedules are there? 5, indicated as C1, C2, C3, C4, and C5. C1 indicates the highest abuse potential with no approved medicinal use. C5 indicates limited abuse potential. Marijuana is still C1. C5, what is that? Like tramadol? I'm trying to think of a C5. Promethazine, codeine. All right. A DE form 222 consists of how many copies? 3. The first copy stays with the pharmaceutical supplier. The second copy is submitted to the DEA by the pharmaceutical supplier. And the third copy remains with the pharmacy. 3 copies, 3 numbers. That's how I'm going to remember it. Which class of drug recalls indicates that the drug may cause serious adverse effects or death? Class 1. What is the key issue in determining which schedule a drug should be listed in? Its potential for abuse. No special forms are necessary for ordering controlled substances from which drug schedules? Schedules 3, 4, and 5. What are electronic versions of DEA Form 222 also known as? E222. How often must a pharmacy conduct a controlled substance inventory? Biannually, every 2 years. Which organization establishes the minimum skill level required by practicing pharmacy technicians? Pharmacy Technician Certification Board, PTCB. Who made these note cards or made the test I gotta take tomorrow? Electronic 222 or E222 forms are available for ordering drugs from which schedules? Schedule 2. Schedule 1 drugs have no approved medical use and should not be ordered. It was Shulgin had a Schedule 1 license. They took it away from him. He was the last one. I think because he made Dow a lot of money or something. I can't remember exactly. Was it Charles Shulgin? I can't remember. Real peek-ow and teek-ow. How long before the intended date of destruction of outdated controlled substances may a retail pharmacy request DEA permission to destroy them? 2 weeks. How many witnesses are required for the destruction of controlled substances? 2. How many classes of drug recalls are there? 3. Class 1 is severe. There's the potential for injury or death. Class 2 is less severe. There is potential for serious adverse effects that may not be reversible. Class 3 is the lowest risk. There is potential for adverse effects, but they are not likely. How long must copies of submitted DEA Form 106 be kept? 2 years. When DEA Form 222 is used, where does the third copy remain? With the pharmacy. DEA numbers are made up of 2-letter prefixes, followed by how many digits? 7. To verify a DEA number, add the first, third, and fifth digits. Add the second, fourth, and sixth digits, then multiply this answer by 2. Add the first total to the second total. The last digit of this total will be the same as the 7th digit in the DEA number. I remember doing that in the 100-hour Walmart training. No, dude. I just called them or something. I don't know. This is an insane process. How long after prescriptions for them are written can Schedule 3 drugs be dispensed? 6 months. Schedule 3, 6 months after written. Marijuana cigarettes are listed in which drug schedule? Schedule 1. federally illegal. Sorry, Colorado, New York, Illinois, California. Drugs in which schedule can contain only limited quantities of certain narcotic drugs. Schedule 5. Examples are antitussives that may contain codeine. Partial fillings for Schedule 2 drugs are allowed. However, the remaining portion must be dispensed within what time period? 72 hours. After 72 hours, the prescription is void and a new prescription must be written for the patient to get the remaining medication. Alprazolam, Xanax, is listed in which schedule? Schedule 4. This drug is approved for medical use and has the limited liability for causing dependency. Let's ask Jordan Peterson. Anabolic steroids are listed in which schedule? Schedule 3. These drugs have accepted medical uses and may cause moderate dependency. I don't know if I agree with those being... I think Xanax should be a 3 too, but what do I know? Drugs that contain amphetamine are listed on which schedule? Schedule 2. Although these drugs have accepted medical uses, they have a high risk for causing physical or psychological dependence. We give them to 5-year-olds, so they'll color on the worksheets better. What was HIPAA designed to improve continuity and portability of? Health insurance. HIPAA stands for Health Insurance Portability and Accountability Act. When DEA Form 222 is used, where does the first copy stay? With the pharmaceutical supplier. How many different items may be ordered on a single DEA Form 222? 10. DEA pharmacy registrations are renewed how often? Triennially, every 3 years. When a registrant's DEA registration is revoked, where must all unused forms be returned? The nearest DEA office. When controlled substances are stolen or lost, what DEA form must be used to report the situation? DEA Form 106. What DEA form must be used when controlled substances become out of date? DEA Form 41. Which person in the pharmacy is allowed to counsel patients? The pharmacist. The technician is not allowed to counsel patients. Maybe on dog shampoo. I don't know. Perhaps. Probably not. Don't quote me on that. How many refills are allowed for Schedule 4 substances? 5. DEA Form 222 from the Drug Enforcement Agency, DEA, is used to order controlled substances from which of the 5 controlled substance schedules? Schedule 3 or Schedule 2. Schedule 1 drugs have no approved medical use and therefore should not be ordered. Schedule 2. DEA Form 222, order Schedule 2. The big boys. Can't order Schedule 1. They're illegal, have no medicinal use, according to the DEA. What is the State Board of Pharmacy designed to regulate and control? The practice of pharmacy. Well, who would have thunk it? How long must the records for controlled substances be kept? 2 years. How many refills are allowed for Schedule 2 substances? 0. 0 are allowed. Too dangerous. How many refills are allowed for Schedule 3 drugs? Good question. And it is 5. So I guess all the other schedules are 5. Schedule 2 is 0. What form is required for all hazardous chemicals or other substances used in pharmacies? Material Safety Data Sheet, MSDS. Throwback to my chemistry days. Chemistry major days. No Walter White, don't get any ideas. It was in college. DEA Form 224. Oh, I did that backwards. Talking about Walter White, got confused. What DEA form is used for a pharmacy's registration? DEA Form 224 to get your pharmacy registered with the DEA, Drug Enforcement Agency. What is the term used to describe the most important principle regarding patients' protected health information? PHI. Confidentiality. Well, that makes sense. What DEA form must be used when controlled substances from Schedule 2 are returned? DEA Form 222. The big daddy of DEA forms. What is the name of the series of numbers assigned to a physician that allows him or her to write prescriptions for controlled substances? A DEA number. It's all about that DEA at the pharmacy. OSHA is a division of which U.S. department? Department of Labor. OSHA stands for Occupational Safety and Health Administration. The Drug Enforcement Administration, DEA, is a bureau of which U.S. department? The Department of Justice. What DEA form is used to order controlled substances? DEA Form 222. So if you don't know what form, guess 222, because that's most of them. What symbol is used to indicate a controlled substance? A C. C. It's generally printed in red on drug labels. Yes, it is. What is another term for a prescription drug? A legend drug. A legendary drug. A prescription drug. That drug is a legend. Drugs used to treat diseases affecting fewer than 200,000 people in the United States are referred to as orphan drugs. Poor drugs. They need a parent, but they don't have one. They're orphans for the 200,000 less people that have that disease. All right. Which schedule lists drugs that possess an extremely high potential for abuse and have no approved medical use? Schedule 1. Examples include heroin, marijuana, and certain opiates. I wonder if heroin was Schedule 1 when Bayer Pharmaceuticals made it. There was no scheduling at that point. Now they just have fentanyl and everything else allotted. Same thing, different name. Actually more powerful. What do I know? All right, last one on here. Which organization accredits healthcare organizations? The Joint Commission. Here we go. We're done with pharmacy law. 8 out of 9 stacks accomplished. Taken care of. I'm going to take just a quick walk just for a second before I tackle this math. And I think I may do this to 1 o'clock. If I can get the test done by then, we'll see. I don't know if I can. All right. Back. I know you were worried about me. I'm back. All right. Last of the cards. These might not be so bad. Who knows? Pharmacy calculations. God help us. Oh, I got to analytical chemistry, and delta G knocked me out of this career choice, but I like reading Thoreau for fun much better. It's much more enjoyable. But it's good weekend money, so let's do it here. All right. What is the Celsius temperature at which water boils? Ooh. 100 degrees Celsius. What if they're all that easy? I might actually enjoy this. How many centimeters are equivalent to 1 inch? .54. I will never remember that. What term is used to describe two equivalent ratios? Proportion. What is a method of mixing solutions that uses arithmetic to determine quantities called? Alligation. What is the Roman numeral for the Arabic number 1? Capital I or lowercase I? What is the Roman numeral for the Arabic number 50? Capital L or lowercase l? These aren't so bad so far. Although I need Final Fantasy 50 to remember that one, but we'll get there eventually. What is the basic unit of volume in the metric system? Liter. L. Compare 1/2 and 1/3. Which is larger? 1/2 is larger than 1/3. If the numerators are the same, the fraction with the smaller denominator has the greater value. I love that they assume you know numerator and denominator, but you don't know that 1/2 is larger than 1/3. All right. Divide 3/4 by 1/16. Oh boy, this is where it's going to get fun. 12. To divide fractions, reduce the fractions to the lowest terms, invert the divisor, multiply the fractions, reduce to lowest terms. I've done this literally thousands of times, and I cannot remember it when I have to do it. See how I do tomorrow. Multiply 2/5 times 3/4. 1/4. To multiply fractions, reduce the fractions to the lowest terms. Multiply the numerators, multiply the denominators, reduce to lowest terms. With math, I can usually figure it out, but I can't remember how I figure it out. I think on the ACT in math, I got like a 24. Math was always what held me back. I got like a 30. I think I got like a 33 in reading. I can't remember. English was 30s, reading 30s, science. I think I got a 29 in science once. But that math, ugh. What is the Roman numeral for the Arabic number 5? Capital V or lowercase v? I know that one. Final Fantasy VII VII. Nerd time. What is the Roman numeral for the Arabic number 10? X, capital X or lowercase x? The formula method uses the following. D over H times Q equals X. What do the letters D, H, Q, and X stand for? D, the desired dose or ordered dosage. H, the dose on hand. Q, the dosage unit or quantity on hand. X, the amount to administer. Compare 2/5 and 4/5. Which number is smaller? 2/5 is smaller than 4/5. If the denominators are the same, the fraction with the smaller numerator has the lesser value. What is the basic unit of weight in the metric system? Gram, abbreviated G. What formula is used to determine cost-benefit analysis? Benefit to cost ratio equals benefits divided by cost. What term is used to describe a fraction whose numerator is expressed and whose denominator is understood to be 100? A percent. Popular in trading. Got to calculate those percents quickly. What is the formula used to determine the flow rate in drops, GTTS, per minute? V over T times C equals R. Boy, I hope there aren't many of those on there tomorrow. You know how often you use that in the pharmacy? Never. It's kind of like the good Lord spared me with mercy on the English teacher test. It was mainly like, who is Ralph Waldo Emerson and what was his philosophy? It wasn't like, circle the gerund. There were 5 of those out of 100. I could do 5 of those out of 100 and that'll be all right. See how sadistic they are. PTCB, hopefully you're kind, filled with grace. What are the 3 methods that can be used for drug dosage calculations? The conversion factor method by using fraction proportion, the ratio and proportion method, and dimensional analysis. I knew I'd see dimensional analysis in here somewhere. What is the formula used to convert between Fahrenheit and Celsius? So in brackets, Fahrenheit minus 32 in brackets divided by 1.8 equals Celsius. What formula is used to convert Celsius to Fahrenheit? 1.8 times Celsius plus 32 equals Fahrenheit. How many tablespoons are equivalent to 1 ounce? 2. What is the marginal difference between actual cost and total reimbursement called? Gross profit. What is the Roman numeral for the Arabic number 100? Capital C or lowercase c? It's like century. That's how I remember it. Century. How many grams are contained in 1 kilogram? 1,000. Metric system keeps it nice and simple. 1,000 kilograms. Kilos, 1,000. How many grains are approximately equivalent to 1 gram? 15.43. How many teaspoons are contained in 1 tablespoon? 3. How many grams are equivalent to 1 ounce? 28.38. How many grams are equivalent to 1 pound? 454. How many pounds are equivalent to 6 kilograms? 13.2. Boy, that is random. I guess they want to see you can do the conversion. How many milliliters are equivalent to 1 gallon? 3,840. How many milligrams are contained in 1 gram? 1,000. Keep it all metric, I'll be all right. How many ounces are contained in 2 pounds? Yes, 32. 16 ounces in a pound. Or keep it all. What is that? British Metro. I can't remember. It's getting late. Imperial. How many micrograms are contained in 1 milligram? 1,000. Yes, keep those 1,000 ones coming. How many fluid drams are in 1 fluid ounce? 8. 8 grams in a fluid ounce. How many milliliters are equivalent to 1 tablespoon? 15. Oh. How many tablespoons are contained in 1 ounce? 2. Add 1/6 and 4/12. 1/2. To add fractions, find the least common denominator, add the numerators together, keep the denominators the same, reduce the answer to the lowest terms. How many fluid ounces are contained in 1 pint? 16. How many pints are contained in 1 quart? 2. How many milliliters are contained in 1 liter? 1,000. How many pints are contained in 1 gallon? 8. Subtract 2/6 from 3/12. 1/12. To subtract fractions, find the least common denominator, subtract the numerators, keep the denominators the same, reduce the answer to the lowest terms. Multiply 3.07 and 0.8. 2.456. To multiply decimals, multiply the whole numbers, add the number of decimal places in the numbers being multiplied. Place the decimal point in the answer, the number of spaces to the right equal to the number of decimal places in the numbers being multiplied. Takes me back to 5th grade. We all use a calculator. Try to remember. Solve the following for x. 5 divided by 30 equals 10 over x. X equals 60. To solve for x, write the proportion, cross multiply, divide. Subtract 17.44 from 64.07. Subtract 17.44 from 68.07. 50.63. To subtract fractions, write the decimals in a column, aligning the decimal points. Subtract the whole numbers. Place the decimal point in the answer directly under the decimal point in the column. To change the percent to a decimal, move the decimal point 2 places to the left or divide by 100. To change a decimal to a percent, move the decimal point 2 places to the right or multiply by 100. Add the following: 4.27 and 0.51. 4.78. To add decimals, write the decimal in a column, aligning the decimal points. Add the whole numbers. Place a decimal point in the answer directly under the decimal point in the column. And the very last card. You should have counted them. Divide 0.2 by 0. Divide 0.02 by 0.6. 30. To divide decimals, write the division problem as a fraction. Move the decimal point so that the divisor is a whole number. Move the decimal point in the dividend the same number of places to the right. Complete the division. We've done it. We have completed the note cards. Look at how many this is. Look at that. We did all those. Thick stack. Whew. Proud of us. Proud of us. Proud of us. Okay. See if I can put. There's me. So, I'm going to take just a second to rest before I dive into this 90 question test. And then I'm going to go to bed, or else I'm not going to do good on this because I didn't get enough sleep. But I'm a completionist, and I want to get the test done. See if I can get these cards in here somehow. Put the cards up. Get the big honking blue ones. These drug names were the worst. Those were the worst. The math wasn't as bad as I thought. Pretty simple. Simple math. Pharmacy law. Form 222. That's the magic form. I gotta kind of bend them. I don't like doing that. Thanks to my good friend Amy for letting me borrow these. She's moved on to bigger and better things, but I appreciate it. Could be helpful for me and hopefully for a lot of other people to get to watch this. Oh, the last cards. How are we gonna get them in there? These out and they can get bent. Try to put a few more cards in here. So we can get the yellow down in there. Oh yeah. Okay. Look at that. I got it all packed up. Packed up in there. Nice. Perfect. Beautiful. Use this makeup mirror. Look nice. At midnight. Sweat. I've been learning so much. I'm starting sweating. Okay, lock that up. Give it to the next victim in the pharmacy. Then we're gonna move on to this. We're gonna try this test. It is 90 questions. 90. It's a lot. We've already done it with the note cards, so we'll just kind of be, yeah. Which one is this? This is math practice. just math. So we're gonna go to the cumulative practice test here. There it is. If you want to pause it, you can write it down. I'm gonna flip to the back and we're just gonna read the question and then read the answer so we get it all down. $26. Do this. Well, it's like flipped around. It was confusing me. Okay. 43. 54. Okay, 64. Oh, is that 64? No, that is. And finally, just these few. All right. So now we're just going to go through the answer key, which will also have the questions on there. If you, is it? Wait, maybe it's different. No, it doesn't have the questions. So a lot of good that did. I'm still going to have to flip back and forth still. Okay. I'm going to figure out a way to do this. Completionist in me. We're going to figure this out. Let's see if I can move my computer over here and figure out a way to set up this book right here. Don't know if it will work. The book is more complicated to get to. Okay, we're gonna figure it out. Give me a second to work on it. All right, microphone. I have another light. That might help. Let's use this big old light. We'll swap. See if the camera can fit over here. Instead, without falling over. That'll be the hard part. It doesn't like that. Okay. Put this up here. See how it does. Oh man. This needs a stupid adapter. Maybe it'll work back here. Maybe. Yeah, it works. Okay. Okay. All right, let's move this thing up. Try to get the cord. There's really no easy way to do this. You know what? Here's what we're going to do. I'm going to take it out of the holder. And we're just going to read through it one by one. There we go. All right. How's that look? There we go. 7. Practice tests. 1. Which of the following is the drug suffix used for histamine 2 blockers? A. Olol. B. Pril. C. Tadine. D. Artan. A is incorrect. The suffix olol refers to beta blockers. B is incorrect. The suffix pril refers to ACE inhibitors. C is correct. The suffix tadine is used for histamine 2 blockers. And D is incorrect. The suffix artan is used for angiotensin 2 receptor blockers. Okay. So, go back to number 2. What is the weight limit of a Class A balance? Oh, let's read the choices. We've got A, 240 milligram, B, 120 milligram, C, 100 milligram, or D, 360 milligram. So A is incorrect. A Class A balance does not weigh this much. B is correct. The weight limit of a Class A balance is 120 milligram. C is incorrect. Class A balances can weigh 100 milligram, but they may weigh even more. And D is incorrect. Class A balances weigh less than 360 milligram. Okay. This is an annoying setup. I gotta find something else. There we go. Which of the following is not considered a possible abbreviation error based on the Joint Commission's Do Not Use list? A, using cc, cubic centimeter, instead of milliliter. B, using apothecary units instead of metric units. C, using stat to mean as soon as possible. Or D, using MS interchangeably to mean both morphine sulfate and magnesium sulfate. Let's go to 3. The correct answer is C. I'm going to take me out of this. I don't need to be in this. There you go. 3 is C. Using stat instead of as soon as possible is acceptable. So A is incorrect. Using CC instead of ML can be an abbreviation error. B is incorrect. Using apothecary units instead of metric units can be an abbreviation error. We said C is correct. Using stat instead of as soon as possible is acceptable. And D is incorrect. Using MS in an unclear manner may be an abbreviation error. All right, so on to question 4. Question 4. Barcode administration technology A reduces medication errors on the patient's label by matching the inpatient's information on the wristband and verifying by scanning the information before medication is administered. B tracks patient compliance in taking maintenance medications and tracks disease management through software systems connected to physicians' offices, hospitals, and pharmacies. C is used to unit dose medications in stock bottles in the centralized pharmacy. Or D includes automatic pumping systems that can compound several sterile ingredients into a finished solution dispensed in a single patient bag without being manually touched by the technician. So we need answer 4. It says A is correct. Barcode administration technology reduces medication errors by using a barcode on the patient's label that matches the inpatient's barcode on their wristband to verify the correct patient is being scanned before medication is administered. B is incorrect because web-based compliance and disease management tracking systems helps to track patients' compliance with taking maintenance medications and tracking disease management through software systems connected to physicians' offices, hospitals, and pharmacies. C is incorrect. Unit dose repacking systems are used to unit dose medications in stock bottles in the centralized pharmacy. And D, IV and TPN compounding devices are automatic pumping systems that can compound several sterile ingredients into a finished solution dispensed in a single patient bag without being manually touched by the physician. 4, 5. The drug ondansetron is used for A, pain, B, diabetes, C, stomach acid, D, nausea. D, ondansetron is used for nausea. I'm not going to read all the other ones. They just say ondansetron is not used for pain, diabetes, and stomach acid. Question 6. Which is a disease or condition of the musculoskeletal system? A, leukemia, B, cystitis, C, angina, D, osteoarthritis. So A is incorrect. Leukemia is a disease of the immune system. B is incorrect. Cystitis is a disease of the urinary system. C is incorrect. Angina affects the circulatory system. And D is correct. Osteoarthritis is a musculoskeletal condition. Question 7. Approximately how many medication errors occur in the United States each year? A, 3 million, B, 5 million, C, 1.5 million, or D, 2.5 million. The correct answer is 1.5 million. So C, correct. Nearly 1.5 million medication errors occur each year. So question 8. The BIN number on a health insurance card A is used by PBMs for network benefit routing and may change depending on what benefit is being billed. B directs the claim to the correct third-party provider. C directs the claim to the specific insurance benefits for that group. Or D is used as an identification tool along with the dates of birth of each person covered, which are listed on the card. So the correct answer is B. Correct. The BIN number directs the claim to the correct third-party provider. The PCN number is used by PBMs for network benefit routing and may change depending on what benefit is being billed. The group number directs the claim to specific insurance benefits for that group. And the patient's date of birth is used as an identification tool. And insurance card displays the dates of birth for each person covered next to his or her name. So, question 9. How is 2014 written in Roman numerals? MMCCVI, MMXIV, MMCXIV, or MMXVI? It's B. Break up the Arabic number. 2014 equals 2000 plus 10 plus 4. Plug in the Roman numeral values. 2000 equals MM, 10 equals X, 4 equals IV, 5 minus 1. Since 1 is before V, MMXIV. 80 more to go. Well. Here we go. The root word LAPAR/O means liver, abdomen, body tissue, breast. And it is B. The root word LAPAR/O refers to the abdomen. Hepat/O refers to liver. Hist/O refers to body tissue. MAM-O or MAST-O refers to the breast. All right. 11. Which of the following is not required on a non-controlled hard copy? A. Patient's name. B. Prescriber's DEA number. C. Patient's phone number. D. Prescriber's name. It doesn't give the answer, but it's B. Although it is normally pre-printed on the hard copy, the DEA number is not required on a non-control. The patient's name is required. The phone number must be included, and it must display the prescriber's name. But on a non-control, you don't need the DEA number. Number 12. What does the drug salmeterol do? A. It prevents asthma attacks and bronchospasms. B. It is used to lower fevers and treat inflammation. C. It is used to treat autoimmune disorders. Or D. It is an estrogen modulator. Salmeterol prevents asthma attacks and bronchospasms. It doesn't do any of the other things. 13. What chapter of the USP addresses non-sterile compounding? 795, 799, 797, or 796? It is 795. Discusses the standards required for non-sterile compounding. There is no 799. 797 addresses sterile compounding. And it just says 796 does not reference non-sterile compounding. 14. What is the answer to 3 over 8 plus 2 over 5 in fractions? 31 over 40, 25 over 40, 12 over 40, or 15 over 40? Here's the answer. A. Find equivalent fractions with the common denominator 40. 3 over 8 equals 15 over 40. 2 over 5 equals 16 over 40. Add the numerators of the fractions and leave the denominator. This fraction cannot be reduced. 3/8 plus 2/5 equals 15 over 40 plus 16 over 40 equals 31 over 40. So that's 14. 15. Harvey Wiley, the chief chemist for the Bureau of Chemistry, helped to pass which act? A. The Pure Food and Drug Act of 1906. B. The Food, Drug, and Cosmetic Act of 1938. C. The Poison Prevention Packaging Act. Or D. The Harrison Narcotics Act of 1914. 15. Here it is. Harvey Wiley helped to pass the Pure Food and Drug Act of 1906. A. 16. Which of the following is the definition of the suffix stomy? Incision, formation, abnormal condition, artificial opening. It is D. The suffix stomy refers to an artificial opening. Tomy refers to an incision. Plasia refers to a formation. Osis refers to an abnormal condition. Stomy refers to an artificial opening. D. 17. Which is not considered a managed care plan? POS plan, HMOs, PPOs, or PAPs? It is D. PAPs are for self-pay patients. POS plans are managed care plans, HMOs are managed care plans, and PPOs are managed care plans. But PAPs are for self-pay patients, so D is correct. 18. Medication errors are the blank leading cause of preventable death and injuries in the United States. First, fifth, fourth, or third? It is D. Medication errors are the third leading cause of preventable death and injuries in the United States. 19. (3,600 milliliters is equivalent to how many liters? 360 liters, 36 liters, 3.6 liters, or 0.36 liters. That's 19. It's 3.6 liters, but it says set up a proportion with milliliters on top and liters on bottom. Recall that 1,000 milliliters equals 1 liter. 1,000 milliliters over 1 liter equals 3,600 milliliters over x liters. Cross multiply and solve for x. 1,000x equals 3,600, x equals 3.6 liters. Note this can also be solved using dimensional analysis, multiplying by conversion ratios to cancel out units until finding the needed units. Here ratios are set up so that unwanted units cross out on top and bottom. 3,600 milliliters times 1 liter over 1,000 milliliters equals 3.6 liters. 19. So we're on to 20. Pharmacodynamics. A is how the action, effect, and breakdown of drugs happen in the body. B is the difference in quantity of medication between the effective dose and the amount that causes adverse side effects. C is when drugs have the same bioavailability. Or D is not applicable if a patient decides not to take a drug the physician prescribes. A is correct. Pharmacodynamics is how the action, effect, and breakdown of drugs happens in the body. B is incorrect. The difference in quantity of medication between the effective dose and the amount that causes adverse side effects is called the therapeutic window. C is incorrect. Bioequivalence is when two drugs have the same bioavailability. And D is incorrect. Pharmacodynamics does not address what happens if a patient decides not to take a drug the physician prescribes. 21. In which year was the Food and Drug Administration formed? 1906, 1938, 1862, or 1901? It was 1906. A. The FDA was formed in 1906. The U.S. Department of Agriculture was formed in 1862, and the Bureau of Chemistry was formed in 1901. FDA, 1906. 22. Which medication error occurs when the prescribed dose is not administered as ordered? A. Wrong dosage form errors. B. Improper dose errors. C. Omission errors. Or D. Compliance errors. 22. Is C. Omission errors occur when the prescribed dose is not administered as ordered. A is incorrect. Wrong dosage form errors occur when the prescribed route of administration of the drug is incorrect. B is incorrect. Improper dose errors occur when the patient receives a lesser dose, a higher dose, or extra doses of the drug than what was prescribed. C is correct. Omission errors occur when the prescribed dose is not administered as ordered. And D is incorrect. Compliance errors occur when the patient does not take the drug the way the doctor prescribes it. 23. Which is not a part of a syringe? A, the tip, B, the plunger, C, the lumen, or D, the barrel? 23. A is incorrect. The tip is where the needle is attached. B is incorrect. The plunger is the cylinder that inserts into the barrel of the syringe. C is correct. The lumen is part of the syringe needle. And D is incorrect. The barrel is the part that holds the medication and displays the calibrations. 24. Third-party payers, A, are contracted by insurance companies to collect payments and debts from patients. B, are the patients. C, are the insurance companies. Or D, are used by the health insurance company to manage prescription drug benefits. 24. 24. A is correct. Third-party payers are contracted by insurance companies to collect payments and debts from patients. B is incorrect. Patients are first-party payers. C is incorrect. Insurance companies are second-party payers. And D is incorrect. PBMs manage prescription drug benefits for health insurance companies. 25. Which incident helped to pass the Food, Drug, and Cosmetic Act of 1938? A, the International Opium Convention. B, the sulfanilamide tragedy. C, the thalidomide tragedy. D, the hundreds of deaths of children under the age of 5 as a result of ingesting drugs and household chemicals. 25. A is incorrect. The Harrison Narcotics Tax Act of 1914 was passed because of the International Opium Convention. B is correct. The Food, Drug, and Cosmetic Act of 1938 was passed because of the sulfanilamide tragedy. Incorrect. The Kefauver-Harris Amendment of 1962 was passed because of the thalidomide tragedy. D is incorrect. The Poison Prevention Packaging Act was passed because of the hundreds of deaths of children under the age of 5 as a result of ingesting drugs and household chemicals. 26. Deteriorated drug errors are A, due to incorrectly monitored drugs that require specific laboratory values for medication and dose selections. B, caused by using expired drugs or drugs whose chemical or physical potency and integrity has somehow been compromised. C, made typically by nurses and drug administration. Errors are due to failure to properly follow protocols, performance deficit, and lack of knowledge. D, when the prescribed dose is not administered at the correct time. 26. 26. A is incorrect. Monitoring errors are due to incorrectly monitored drugs that require specific laboratory values for medication and dose selections. B is correct. Deteriorated drug errors are caused by using expired drugs or drugs whose chemical or physical potency and integrity has somehow been compromised. C is incorrect. These situations are called wrong administration technique errors. And D is incorrect. These instances are wrong time errors. 27. Which is not a type of medication order? A, scheduled. B, as needed. PRN. C, blood testing. D, controlled substance. 27. A is incorrect. Scheduled medication orders are for those medications given around the clock. B is incorrect. PRN is a type of medication order. These medications are provided on an as-needed basis. C is correct. Blood testing is not a type of medication order. And D is incorrect. Medication orders include controlled substances. 28. Multiply 4/5 by 7/8. What is the answer in the lowest possible terms? A, 28 over 40, B, 4 over 20, C, 14 over 20, or D, 7 over 10? 28. D, multiply numerators across and denominators across. 4 over 5 times 7 over 8 equals 4 times 7 over 5 times 8 equals 28 over 40. Reduce, simplify answer to simplest terms. 28 over 40 equals 7 times 4 over 10 times 4 equals 7 over 10. 29. Which digestive enzymes do not pass from the exocrine tissue of the pancreas to the small intestine? A, pancreatic amylase, B, trypsin, C, pancreatic lipase, or D, insulin? 29. A is incorrect. Pancreatic amylase is a digestive enzyme that passes to the small intestine. B is incorrect. Trypsin is a digestive enzyme that passes to the small intestine. C is incorrect. Pancreatic lipase is a digestive enzyme that passes to the small intestine. And D is correct. Insulin is not a digestive enzyme. 30. What can workers do in the clean room? A, garb, B, generate labels, C, prepare CSPs, D, wash hands? 30. A is incorrect. Workers may only garb in the anteroom. B is incorrect. No paper is permitted in the clean room, so labels must be generated in the anteroom. C is correct. CSPs are prepared in the sterile room under the laminar airflow hood. And D is incorrect. Workers can use an antibacterial solution to sterilize their hands in the clean room, but aseptic hand washing is done at the faucet in the anteroom. 31. The U.S. Pharmacopoeia, USP, was developed under which act? The Food, Drug, and Cosmetic Act of 1938, the Controlled Substance Act, the Orphan Drug Act, or the Pure Food and Drug Act of 1906? 31. A is correct. The Food, Drug, and Cosmetic Act of 1938 developed the USP. B is incorrect. The Controlled Substance Act controls the manufacture, importation, possession, use, and distribution of certain controlled substances. C is incorrect. The Orphan Drug Act supports the development drugs to treat rare or orphan diseases. And D is incorrect. The Pure Food and Drug Act of 1906 required manufacturers to properly label a drug with truthful information. 32. Which drug is considered a salad drug? A, alprazolam, B, meloxicam, C, hydrochlorothiazide, or D, clomiphene? 32. It's D. Clomiphene is a salad drug. 33. Drug duplication. A is when a drug is prescribed that shares an active ingredient with the medication a patient is already taking. B is when drugs are in the same drug class or have the same function in the body. C is when drugs contain more than one active ingredient to treat separate conditions. Or D could be anything that causes restrictions on the patient. 33. A is correct. Drug duplication happens if a patient is prescribed a new drug that contains an active ingredient shared by a medication he or she already takes. B is incorrect. Therapeutic duplication refers to situations when drugs are in the same drug class or have the same function in the body. C is incorrect. Drugs have more than one active ingredient in them that are used for separate conditions are called combination drugs. D is incorrect. Special conditions could be anything that causes restrictions on the patient. So that was 33, on to 34. How many tablespoonfuls are in 2 ounces? 4 tablespoons, 2 tablespoons, 1 tablespoon, or 3 tablespoons? 34. It's A. Set up a proportion with ounces on top and tablespoons on the bottom. Recall that 1/2 fluid ounce equals 1 tablespoon. 1/2 fluid ounce over 1 tablespoon equals 2 fluid ounces over x tablespoons. Cross multiply and solve for x. 1/2 x equals 2. X equals 4 tablespoons full. Note this can also be solved using dimensional analysis, multiplying by conversion ratios to cancel out units until finding the needed units. 2 fluid ounces times 1 tablespoon over 1/2 fluid ounce equals 4 tablespoons full. 35. Which act or amendment required that the phrase, "Caution, federal law prohibits dispensing without a prescription," be placed on prescription labeling? A. The Food, Drug, and Cosmetic Act of 1938. B. The Kefauver-Harris Amendment of 1962. C. The Durham-Humphrey Amendment of 1951. Or D. The Controlled Substance Act. 35. A is incorrect. The Food, Drug, and Cosmetic Act of 1938 required a ban on false claims, required package inserts with directions to be included with products, and required exact labeling on the product. B is incorrect. The Kefauver-Harris Amendment gave the FDA the authority to approve a manufacturer's marketing application before the drug was to become available for consumer or commercial use. C is correct. The Durham-Humphrey Amendment required the phrase, "Caution, federal law prohibits dispensing without a prescription," be placed on prescription labeling. And D is incorrect. The Controlled Substance Act controls the manufacture, importation, possession, use, and distribution of certain controlled substances. 36. Which is not a side effect of Montelukast? A. Diarrhea, B. Headache, C. Flu symptoms, or D. Sore throat? 36. A is correct. Diarrhea is not a side effect of Montelukasts. All the others are possible side effects. 37. POS plans still require an in-network primary care physician. However, a patient can get out-of-network services at a higher cost. B, usually limit coverage to care from in-network doctors and specialists for a fixed annual fee and or copayment for services rendered. C, allow patients to see any in-network physician or specialist without needing a prior authorization, although they need to meet annual deductibles. Or D, provide coverage to people who are injured on the job. 37. A is correct. POS plans still require an in-network primary care physician, but a patient can get out-of-network services at a higher cost. B is incorrect. HMO plans usually limit coverage to care from in-network doctors and specialists for a fixed annual fee and/or co-payment for services rendered. C is incorrect. PPO plans allow patients to see any in-network physician or specialist without needing a prior authorization, although they need to meet annual deductibles. And D is incorrect. Workers' compensation provides coverage to people injured on the job. 38. How often should the weights on a Class A balance be calibrated? A, every 6 months, B, every other year, C, 3 times a year, or D, annually? 38. It's D. Class A balances must be calibrated and certified every year. 39. The prefix CIRRH means A, green, B, blue, C, red, or D, yellow. The prefix Sierra means 39. It's like cirrhosis of the liver. Here, it gives them all. The prefix chlor means green. The prefix cyan is blue. The prefix eryth means red. And the prefix Sierra means yellow. So D is correct. Yellowing of the liver, cirrhosis of the liver, I think is what that means. 39. 40. What is a potential error if there is a mix-up between the salad drugs clonidine and Klonopin? A, renal failure, respiratory arrest, and even death. B, loss of seizure control, hypotension, and other serious consequences. C, hypoglycemia or poor diabetes control. Or D, inability to manage pain, abnormal psychiatric symptoms, or other serious consequences. 40. A is incorrect. Arrows and amphotericin B products could result in renal failure, respiratory arrest, or even death. B is correct. Confusing clonidine and Klonopin may result in loss of seizure control, hypotension, and other serious consequences. C is incorrect. Mixing up different forms of insulin may result in hypoglycemia or poor diabetes control. And D is incorrect. Confusing the salad drugs tramadol, trazodone, and toradol may result in an inability to manage pain, abnormal psychiatric symptoms, or other serious consequences. 41. Which act outlines the process for drug companies to file an abbreviated new drug application, ANDA? A, the Drug Price Competition and Patent Term Restoration Act of 1984. B, the Health Insurance Portability and Accountability Act, HIPAA, of 1996. C, the Patient Protection and Affordable Care Act of 2010. Or D, the Drug Listing Act. 41. A is correct. The Drug Price Competition and Patent Term Restoration Act of 1984 outlines the process for drug companies to file an abbreviated new drug application, ANDA. B is incorrect. The Health Insurance Portability and Accountability Act, HIPAA, of 1996 established protected health information and safeguards patient privacy. C is incorrect. The Patient Protection and Affordable Care Act of 2010 required individuals to have health insurance and required insurance companies to cover all individuals with new minimum standards in order to increase the quality and affordability of healthcare. And D is incorrect. The Drug Listing Act implemented the National Drug Code Number, NDC. 42. Which of the following is not true about refill authorizations? A, they are called in by the patient. B, they may not be approved for controlled substances due to federal and state laws. C, further refills are called in by the doctor. Or D, they may not be approved for short-term conditions, e.g. cough medicines. 42. A is correct. The doctor must approve a refill authorization. B is incorrect. Authorizations may be approved for controlled substances may not be. B is incorrect. Authorizations may not be approved for controlled substances due to federal or state laws. C is incorrect. Refill authorizations are called in by the doctor. And D is incorrect. Refill authorizations may not be approved for short-term conditions. So it's A. The doctor must approve a refill authorization. 43. How is MMMDCVI written in Arabic numerals? A, 3606, B, 3666, C, 366, or D, 1306. 43. 43. A. Break up the Roman numeral. MMMDCVI equals MMM plus T plus C plus V plus I. Plug in the Arabic numeral values. MMMDCVI equals 3000 plus 500 plus 100 plus 5 plus 1 equals 3606. 43. 44. The suffix Raxol refers to which drug class? A. Opioid narcotics. B. Proton pump inhibitors. C. ACE inhibitors. Or D. Benzodiazepine. 44. Okay. So A is incorrect. Codone refers to opioid narcotics. B is correct. The suffix Praxol refers to proton pump inhibitors. C is incorrect. The suffix Pril refers to ACE inhibitors. And D is incorrect. The suffix PAM refers to benzodiazepines. 45. Halfway through this test. 45. In hospitals, how many people die annually from medication errors? A, 100,000. B, 400,000. C, 300,000, or D, 500,000. 45. 45 is B. Every year, 400,000 people die in hospitals due to medication errors alone. 400,000. 46. Hey, we're on the downhill slide now. 46. Which is an abbreviation used for a nursing unit in the hospital? A, ATC, B, ENDO, C, STAT, STAT, or D, TID. 46. ATC means around the clock. Endo means endoscopy, so B is correct. Stat means right away. TID means 3 times daily. 47. How many digits does an NDC number consist of? A, 9, B, 10, C, 12, D, 8. 47. It is, 47 is B. NDC numbers contain 10 digits. NDC numbers, 10 digits. 47. 48. 48. With TRICARE, which plan is an HMO? A, standard, B, extra, C, prime, or D, basic? 48. A is incorrect. Standard is a fee-for-service cost-sharing plan. B is correct. Extra is an HMO plan. C is incorrect. Prime is a PPO with a POS option. And D is incorrect. Basic is not a plan at all under TRICARE. So it's B. Extra is an HMO plan. 49. 49. Which is not a microorganism that can be transmitted during sterile compounding? A, fungi, B, amoeba, C, bacteria, D, virus. 49. 49. Incorrect. Fungi can be transmitted during sterile compounding and can cause yeast and fungal infections in patients. B is correct. Amoebas are not found in pharmacy environments. C is incorrect. Bacteria can be transmitted by sterile compounding and cause pyrogens to enter the bloodstream if the technician does not comply with the septic technique. And D is incorrect. Viruses can be transmitted if the technician does not comply with the septic technique. So it's B. Amoebas are not found in pharmacy environments. 50. Online adjudication. A is the process of sending a claim to the third-party payer for reimbursement. B is the deductible. C refers to billing the third party for goods and services rendered. Or D is the compensation given to the pharmacy after collection of the patient's copay or deductible. 50. A is incorrect. Claim submission is the process of sending a claim to the third-party payer for reimbursement. B is incorrect. Coinsurance is the deductible. C is correct. Online adjudication is billing a third party for goods and services rendered. And D is incorrect. Reimbursement is the compensation given to the pharmacy after collection of the patient's copay or deductible. 51. Which of the following is 1/4 of a grain equivalent to? A, 1 milligrams, B, 15 milligrams, C, 30 milligrams, or D, 60 milligrams? I think it has milligrams. MGS? I don't know what that is. 51. 51. Set up a proportion. It's B. Set up a proportion with grains on top and milligrams on the bottom. Recall that 1 grain equals about 60 to 65 milligrams. Use 62 milligrams. 1 grain over 62 milligrams equals 1/4 of a grain over X milligrams. Cross multiply and solve for X. X equals 62 times 1/4. X equals about 15 milligrams. Note this can also be solved using dimensional analysis, multiplying by conversion ratios to cancel out units until finding the needed units. 1/4 of a grain times 62 milligrams over 1 grain equals about 15 milligrams. 52. Which of the following is not a cause of high cholesterol? A, poor diet, B, smoking, C, genetic factors, or D, exercise? 52. Poor diet can cause high cholesterol, so it's not A. Smoking is a cause of high cholesterol, so it's not B. Genetic factors may cause high cholesterol, so it's not C. It's D. Exercise is not a cause of high cholesterol. 52, D, exercise. 53. Most medication errors occur because of all of the following except A, education and training, B, failure to follow procedures, C, poor performance, or D, miscommunication. 53. A, correct. Education and training prevent medication errors. Fail to follow procedures can cause them, poor performance can cause them, and many medication errors are caused by miscommunication. So it's A, education and training prevent medication error. 54. If a patient has a history of drug abuse, pharmacists do all of the following except A, monitor controlled medications, B, put restrictions on controlled medications, C, make sure the patient is complying with the directions, or D, tell a family member to monitor the patient's use of the medication. 54. So A is incorrect. The pharmacist may monitor the medication. B is incorrect. The pharmacist may put restrictions on the medication. C is incorrect. The pharmacist may make sure the patient is complying with the directions for use. But D is correct. The pharmacist would be violating HIPAA if she or he told a family member to monitor the patient without the patient's permission. 54. So we're on 55. 55. How many milligrams are equivalent to 5.8 grams? A, 58 milligrams, B, 0.58 milligrams, C, 580 milligrams, or D, 5,800 milligrams? 55. 55. It's D. Set up a proportion with G on top and milligram on bottom. Grams on top, milligrams on bottom. Use the fact that 1 gram equals 1,000 milligrams. 1 gram over 1,000 milligrams equals 5.8 grams over X milligrams. Cross multiply and solve for X. X equals 5,800 milligrams. 56. 56. The first 5 digits of the NDC number refer to the A, labeler, B, drug, C, package, or D, pharmacy. 56. A is correct. The first 5 digits refer to the labeler code. The second group of numbers refers to the drug code. The last 2 digits refer to the package code. The pharmacy is not identified on the package code, so it's A. The first 5 digits refer to the labeler code. 56. 57. Medication errors that occur because of metabolism problems in patients are due to A, social causes, B, calculation errors, C, abbreviation errors, or D, physiological makeup. 57. A is incorrect. Social causes of medication errors are not due to metabolism problems in patients. B is incorrect. Calculation errors are not due to metabolism problems in patients. C, incorrect. Abbreviation errors are not due to metabolism problems in patients. D is correct. Physiological makeup causes medication errors because of metabolism problems in patients. 58. Which form of hepatitis cannot spread by sexual contact? A, hepatitis A, B, hepatitis B, C, hepatitis C, or D, hepatitis cannot be transmitted sexually. 58. A is correct. Hepatitis A is spread by contamination of food and water. Hepatitis B and C can be spread through sexual contact. A, correct. Hepatitis A is spread by contamination of food and water. 59. NDC numbers were implemented under which act? A, the Orphan Drug Act. B, the FDA Modernization Act. C, the Medicare Modernization Act. Or D, the Drug Listing Act of 1972. 59. A is incorrect. B is incorrect. C is incorrect. D is correct. The Drug Listing Act of 1972 implemented NDC numbers. 60. Which is a part of Medicare Part A? A, used for doctor services. B, covers Medicare Advantage plans. C, covers prescription drugs. D, used for inpatient stays. 60. It is D. Medicare Part A is used for inpatient stays. It does not cover any of the other things. It's not used for doctors, doesn't cover Medicare Advantage plans, does not cover prescription drugs. Not used for doctor services. It is used for inpatient stays in the hospital. 60. 61. The SIG code QID is defined as A, every day, B, every other day, C, 4 times daily, or D, 3 times daily. 61. QD is the SIG code for every day, so A is incorrect. B is incorrect. The SIG code for every other day is QOD. C is correct. QID means 4 times daily. And D is incorrect. DID means 3 times daily. 62. Which is not a part of the clean room of the pharmacy? A, the faucet. B, laminar airflow workbench. C, barrier isolators. Or D, buffer area. 62. A is correct. The faucet is located in the anteroom. B is incorrect. The laminar airflow workbench is where the technician prepares CSPs in the clean room. C is incorrect. Technicians use barrier isolators in the clean room as another safeguard against contamination so they can prepare CSPs in an aseptic box under the hood. And D is incorrect. The buffer area is the area immediately next to the laminar airflow hood in the clean room. So A is correct. The faucet is located in the anteroom. 63. Which is not a true statement in regards to expired medications? A, drugs expiring within 1 month must be pulled from the shelves. B, if a drug's expiration date states 6/19, the drug is good until 6/30/2019. C, stock bottles should be marked accordingly to alert staff that the medication is expiring within the next 3 months. Or D, expired medications must be stored in a designated area away from regular stock. 63. A is incorrect. Drugs expiring within 1 month must be pulled from the shelves. B is correct. If a drug's expiration date states 6/19, the drug will indeed expire on 6/30/2019. C is incorrect. It is true that stock bottles should be marked accordingly to alert staff that the medication is expiring within the next 3 months. And D is incorrect. Expired medications must be stored in a designated area away from regular stock. 64. Another word for co-insurance is A, deductible, B, fee for service, C, retrospective payment, or D, dispensing fee. 64. 64. A is correct. Another word for co-insurance is deductible. Fee for service is not a deductible. Retrospective payment is not a deductible. Dispensing fee is not a deductible. Another word for co-insurance is deductible. A is correct. 65. What is a part of a syringe needle? A, a filter, B, adapter, C, a shaft, or D, a tip. 65. 65. A is incorrect. A filter removes unwanted particles from a solution. B is incorrect. An adapter is an attachment used for transferring medication from an IV bag to a vial and vice versa. C is correct. The shaft is the long, narrow, hollow point of the needle. And D is incorrect. The tip is a part of the syringe, not the needle. The needle is attached to the syringe at the tip. 66. In the expression 3/8 plus 2/5, what is the lowest common denominator? A, 20, B, 40, C, 4, or D, 8? 66. B, the least common denominator is the least common multiple of 8 and 5. 5 has 5, 10, 15, 20, 25, 30, 35, 40. And 8 is 8, 16, 24, 32, 40. 67. The prefix peri means A, inner, B, around, C, out, or D, under. 67. 67. Indo means inner. B is correct. The prefix peri means around. The prefix exo means out, and the prefix sub means under. So peri means around. B is correct. 68. Which medical device class of the Medical Device Amendment of 1976 referred to general controlled devices with low risks to humans? A, Class 4, B, Class 2, C, Class 1, or D, Class 3? 68. A is incorrect. There is no Class 4 listed in the Medical Device Amendment of 1976. B is incorrect. Class 2 devices are performance standard devices that are considered to pose moderate risks for human use. C is correct. Class 1 devices are general controlled devices that are low risk for human use. And D is incorrect. Class 3 devices require pre-market approval applications that are the equivalent of a new drug application. 69. 69. Which of the following groups is most commonly affected by calculation errors? A, the elderly, B, women, C, children, or D, men? 69. So it's C. Children are most commonly affected by calculation errors. 69. Children. Number 70. Which agency has the complete authority to enforce the Resource Conservation and Recovery Act of 1976? A, the FDA, B, the DEA, C, the CIA, or D, the EPA? 70. It is D. The EPA has the complete authority to enforce the Resource Conservation and Recovery Act of 1976. 71. If a healthcare provider is unable to make an outpatient comply with directions for the use of a prescription drug, this error is due to A, physiological makeup, B, an abbreviation error, C, a calculation error, or D, social causes. 71. Okay. 71. A is incorrect. Medication error due to patient noncompliance with directions for medication use is not a result of the patient's physiological makeup. B is incorrect. An abbreviation error would not result in a medication error due to intentional patient noncompliance with directions for medication use. C is incorrect. A calculation error would not result in a medication error due to intentional patient noncompliance with directions for medication use. And D is correct. Patient noncompliance with directions for medication use is a medication error due to social causes. 72. Which dosage is not presented on a dose response curve in regards to clinical trials? A, TD50, B, LD50, C, RD50, or D, ED50? 72. All right, it is C. There is no RD50 dose on a dose response curve. All the rest are dosages found on a dose response curve. RD50 is not. C is correct. 73. Which DAW means the prescriber is not allowed generic substitution? A5, B8, C1, or D3? 73. All right, A is incorrect. DAW5 means that a brand name medication is dispensed at generic price. Substitution is allowed. B is incorrect. DAW8 means the generic version of a drug is not available. Substitution is allowed. C is correct. DAW1 indicates that substitutions are not allowed by the prescriber. This is used when the doctor deems the brand medication is medically necessary and substitution is not allowed. And D is incorrect. DAW3 indicates that the pharmacist selected the brand name, although substitution is allowed. 74. Which is not an incidence of noncompliance in regards to MTM? A, a patient takes another person's medication to avoid copays. B, the patient's doctor discontinued the medication. C, the patient is skipping doses. Or D, a patient has stopped taking his or her medication altogether. 74. I wish they were all this easy. Taking another person's medication to avoid copays is being non-compliant, so A is incorrect. B is correct. If the patient is not taking a medication because the doctor discontinued the medication, the patient is still compliant. Skipping doses is non-compliant. And if you quit taking it altogether without your doctor's approval, that's also non-compliant. So it's B is correct. If the doctor tells you to quit, you're still compliant. 75. 15 left. Child doses are calculated by the child's A, weight, B, height, C, age, or D, grade. 75. 75 is A. Child doses are calculated by weight and BSA. The others are not used to calculate the child medication dose. 76. What is not necessary in garbing up? A, shoe covers, B, mask, C, gloves, or D, to wash the face. 76. A is incorrect. Shoe covers are required. They are the first PPE put on when garbing up. B is incorrect. Technicians use masks to avoid contaminating the clean room with body particulates. C is incorrect. Gloves are required in the clean room, so they are an important part of garbing up. And D is correct. Although technicians and other workers should wear minimal or no makeup in the clean room, they are not required to wash their faces while garbing up. D is correct. 77. How many drams are in 4 ounces? A, 16 drams, B, 8 drams, C, 32 drams, or D, 4 drams. 77. 77 is C. Set up a proportion with ounces on top and drams on bottom. Recall that 1 fluoride ounce equals 8 drams. 1 fluoride ounce over 8 drams equals 4 fluoride ounces over X drams. Cross multiply and solve for X. X equals 32 drams. Note, this can also be solved using dimensional analysis, multiplying by conversion ratios to cancel out units until finding the needed units. 4 fluoride ounces times 8 drams over 1 fluoride ounce equals 32 drams. That's 77, 78. Which of the following does the drug sulfonylcholine treat? A, blood pressure, B, pain, C, anesthesia, D, it is an immunosuppressant. 78. It is not used to treat blood pressure. It is not used for pain. C is correct. Sulfonylcholine is used as anesthesia and is a paralytic agent. And it is not an immunosuppressant. It is anesthesia and a paralytic agent. 78. 79. About what percentage of the United States population has insurance? A, 99%, B, 75%, C, 84%, or D, 63%? 79. A is incorrect. While more Americans than ever before are insured, this number is far too high. So it's not 99%. It is C. As of 2016, about 84% of Americans are insured. 84%. Sorry to those 16%. 80. 10 left. 80. 480 milliliters is equivalent to how many pints? A, 2 pints, B, 4 4 pints, C, half a pint, or D, 1 pint. 80. Is D. Set up a proportion with milliliters on top and pints on the bottom. Recall that 480 milliliters equals 1 pint. 480 milliliters over 1 pint equals 480 milliliters over X pints. Cross multiply and solve for X. 480X equals 480. X equals 1 pint. Note, this can also be solved using dimensional analysis, multiplying by conversion ratios to cancel out units until finding the needed units. 480 milliliters times 1 pint over 480 milliliters equals 1 pint. That's 80. 81. 81. Which drug is considered a high alert medication? A, metronidazole. B, potassium chloride injections. C, ketorolac. Or D, lisinopril. 81. Is what I thought it was. B, potassium chloride injections are considered high alert. Pretty sure that's what they use for lethal injections. So that would make sense. Potassium chloride. 81. 82. 82. Arteries, A, transfer blood away from the heart. B, transfer blood to the heart. C, are small vessels found in the tissue. D, are thin-walled valve structures that carry lymph. 82. 82. A is correct. Arteries carry blood away from the heart. Veins carry it to the heart. Capillaries are the small vessels in the tissue. And D, thin-walled valve structures that carry lymph are called lymph vessels. So it's A. Arteries carry blood away from the heart. 82. 83. 83. What is the main purpose of MTM? A, to reduce costs for insurance companies. B, to increase calls to doctors to obtain refills. C, to advise patients of delivery or mail order options. Or D, to improve patient compliance. 83. 83. A is incorrect. MTM is not necessarily intended to reduce costs. B is incorrect. While calling in refills to a doctor helps with patient compliance, it is not the main purpose of MTM. C is incorrect. Advising patients of delivery and mail order options aids compliance, but it is not the purpose of MTM. D is correct. MTM is intended to improve patient compliance. Need to look up what MTM is. Slipping my mind here in the evening. So 84. 84. Orphan drugs are A, drugs that cure diseases. B, prescribed for common diseases and conditions. C, pharmaceuticals that are developed specifically for rare diseases. Or D, drugs anyone can qualify to use. It's C, but let's see why. 84. 84. A is incorrect. Orphan drugs do not necessarily cure diseases, they only treat certain ones. B is incorrect. Orphan drugs are rarely used and are not intended for common diseases or conditions. C is correct. Orphan drugs are pharmaceuticals that are developed specifically for rare diseases. And D is incorrect. Orphan drugs are not appropriate for all patients. 85. 85. Hypertension occurs when the blood pressure reading is over A, 120 over 80, B, 100 over 70, C, 140 over 90, or D, 110 over 60. 85. And it is A is incorrect. 120 over 80 is considered normal blood pressure. B is incorrect. 100 over 70 is not considered high blood pressure. C is correct. A reading over 140 over 90 is considered high. And D is incorrect. 110 over 60 would be low blood pressure. So C is correct. 140 over 90 is considered high blood pressure. 86. 5 left. Last page. Look at that. Beautiful last page. 86. What information is not found in a compounding log? A, physician's name. B, lot number. C, pharmacist's initials. Or D, beyond use date. 86. 86. A is correct. The physician's name is not required in the compounding log. It is required on the prescription label. B is incorrect. The lot number of the medication compounded is needed in order to refer back to the product for recall or other purposes as necessary. C is incorrect. The pharmacist initials the compound to show that he or she verified it. And D is incorrect. The beyond use date is required because once the medication is compounded, the expiration date is different from the date on the manufacturer's packaging. 87. Benztropine is an A, Alzheimer's disease medication, B, anti-tremor medication, C, anti-anxiety medication, or D, antidepressant medication. 87. So benztropine. B is correct. It is an anti-tremor medication. It does not do the other things. It's an anti-tremor medication. 87. 88. Which of the following is not a part of the patient's profile? A, allergy information. B, spouse's name. C, patient's date of birth. Or D, insurance information. 88. A is incorrect. Allergy information is always included in the patient's profile. B is correct. Spousal information is not required for a patient profile. Date of birth is always in the patient's profile, and insurance information has to be correctly entered in their profile. So spousal information is not required for a patient profile. 89. 89. All of these are strategies used to differentiate salad drugs from regular stock except A, avoiding the risk by not stocking salad drugs in the pharmacy, B, using tall man lettering, C, color coding, or D, stocking salad drugs in a different area in the pharmacy away from the regular stock. 89. 89. A is correct. It is not realistic to avoid stocking salad drugs in the pharmacy. B is incorrect. Using tall man lettering is one strategy to differentiate salad drugs from other drugs in the pharmacy. C is incorrect. Color coding is a strategy to differentiate salad drugs from other drugs in the pharmacy. And D is incorrect. Stocking salad drugs in a different area in the pharmacy away from the regular stock is one way to differentiate them from other drugs. I gotta brush up on what salad drugs are. They talked about them a lot. 5 hours of studying. I have not seen it explained. All right, last question. How many milliliters are in 2 teaspoons full? A, 15 milliliters, B, 5 milliliters, C, 10 milliliters, or D, 20 milliliters? Last question, last answer. It is C, 10 milliliters. Set up a proportion with milliliters on top and teaspoons on bottom. Recall that 5 milliliters equals 1 teaspoon. 5 milliliters over 1 teaspoon equals X milliliters over 2 teaspoons. Cross multiply and solve for X. X equals 10 milliliters. Note this can also be solved using dimensional analysis, multiplying by conversion ratios to cancel out units until finding the needed units. 2 teaspoons times 5 milliliters over 1 teaspoon equals 10 milliliters. And we are done. It says you can take a second test at that link there. Much thanks to Essentia. I still think you're going to sell a lot of books. A lot of people aren't going to like this shoddy camera work here. But hey, we did it. For those that wanted to study with a guy in his kid's toy room, this is the way to do it. We did all the cards. I'm proud of us. We've seen the cards before. Let me turn this off and turn myself back on here. There we go. Woo! It's over. Did it. Now, I've studied for 5 hours and 11 minutes. So, at this point, the test is in 13 hours. Take me a couple hours to drive there. So 11 hours. If I go to sleep now, I can still get 8 hours of sleep. I'm going to be all right. So, if that helped any of you out, I'm hoping this is a video that'll stay up for a long time, and like as more people get certified, they'll keep watching it. I went through every single note card, study card for this test. Every single one. Took like 3 or 4 hours. I went through every question in the practice tests. Question and answer. Okay? 5 hours and 12 minutes. It's something you can just listen to while you're walking in chunks or whatever. I'll try to go back through and put chapters in there sometimes. So if you're grateful for me helping you study, in the description, I have my Patreon. I have a Buy Me a Coffee. I have a PayPal, some crypto links, whatever you can do to help out. You can do a super chat, super sticker, super thanks, whatever. It doesn't matter. Or if not, that's cool too. I hope I just helped you get certified, make a little extra money, take care of your family, because pharmacy techs are a super important working class career job, and you should. Yep. That's the last thing I'll tell you. I love y'all. God bless. I'm hitting stop streaming, and I'll see you next time. Hope you got something helpful out of that. Like, subscribe, give me a little, but you know, whatever. Thanks for checking it out. Peace out.